Good morning, everyone. We're just going to take a moment to check and make sure we can be heard in the Zoom webinar.
Thank you.
Yes, I'm hearing you well, Sam. Thank you.
Oh, great. Terrific. Thank you, Matthew. Chair Pyska, we will be ready to begin on time.
Ready? Okay, good morning and welcome to February 7th Board of Supervisors meeting. We'll call this meeting to order and we will start with a moment of silence. I know we have several. I'll start with just the communities in Syria and Turkey recovering from the earthquakes and what a long haul that's going to be. And I know we have someone from behavioral health that wants to come up.
Morning Board, Todd Metcalf, Behavioral Health Services. I would like to take a moment to dedicate this moment of silence to two valued staff members who recently passed away. David Brody, who was a behavioral health clinical specialist, started with us back in 2020. He's been an extremely valuable member of our teams, and his kind heart and dedication to the community will be sorely missed. Craig Keene who was a client support assistant too, coordinated all of our client transport, and pulled out all the stops to make sure people needed to be where they needed to be, when they needed to be there. He'd been with the department since 2011. The pride Craig took in his work was extremely admirable, and he was an amazing asset not only to our department but to our clients as well. So our deepest condolences to his families, or their families and friends. So thank you. Wow.
Thank you, Todd.
Thank you.
Supervisor Sabatier?
Thank you. Just wanted to give my condolences to the family and friends of Denise Dietrich. She used to own, with her husband, Dietrich Tires in Lower Lake, lived in the city of Clear Lake, and unfortunately passed away recently, and just wanted to make sure that we held all of her family and friends in our hearts.
Do we have any others on the board? No? Okay. Director Turner, do you want to lead us in the pledge?
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Do we have any items, extra items? Not appearing on the posted agenda? No? Okay. And then, any from the public? An extra item?
No.
Okay.
A quick 3-minute.
Yeah, we'll get to that in
Okay,
just one moment.
I haven't been here in years, so.
Okay. And then number 5, we'll go to our consent agenda. Do we have anything to be pulled today? Supervisor Spatier?
Yes, I'd like to pull item 5.14. No, that's not the correct one. Yes, 5.14, just for clarification, and then 5.20 for further discussion later this afternoon.
And 5.26 from admin. Okay. Does the public have any items that they wish to pull from the consent agenda? Not seeing any. Then I'll bring it back to the board for action.
Madam Chair, I'll motion to approve the consent agenda, items 5.1 through 5.13, 5.15 through 5.19, 5.21 through 5.25, and 5.26 through 5.29.
Or 5.27.
Oh, sorry, 5.27 through 5.29. Thank you.
Second.
Okay, we have a motion and a second. All in favor?
Aye.
Any opposed? Okay, motion passes. We'll just wait until 9:06. Yeah. Okay, 9:06 items, 6.1, public input. This is where members of the public can come up and speak for 3 minutes. We do have one already, request from Elaine Brown. If you'd like to come up. And thank you for coming back again this week.
Thanks for giving more time to prep, so thank you.
Hi, I'm very honored to be able to speak before you today, and I'm bringing before you a passion of mine, and it comes in lieu of the post-COVID time that we're in. COVID has, been a really hard situation for many of us, and it has been difficult for me. And so in that response, how do we deal with that? And in education, this is my response. And my objective here is to work in a position developing thriving communities by networking with local, national, and international agencies, along with diverse thinkers incorporating seasoned and youth leadership, providing long-term solutions to challenges in an ever-changing world. So I have worked with Project BASE. Project BASE is a philosophy in education. I handed out a packet to you. If you look on the back of that, there's a picture of a class that in 2011 worked on a project trying to save an endangered species called the vaquita in the Gulf of California, which is in Mexico. And it is through that process that I realized the power of children, building their community, changing their world. That class did a letter campaign to places like Nike, Tim Tebow, and Princess Kate, and received letters back from those places. And the power of children changing their community is beyond what I could have imagined. And so I'm speaking to the board because I believe this is something that we could utilize in this county of Lake County. I'm particularly interested in agriculture. I worked for an agricultural-based tour in Ivanhoe, California called Farmer Bob's World at McKellar Family Farms. And I learned a lot about ag during that time. I actually toured his family, one of the representatives of that area, and we talked and we're on the same page. In Sacramento, they don't really understand agriculture, and this is a really rich agricultural community. Also ecological systems. Our lake, I love this lake. I'm new to the area, but wow, what a gem you're sitting on. It rivals Yosemite, California, which I used to live near. And the commerce that could be developed here that once was, get children behind that, developing that community, bringing back, figuring out what's wrong with the lake. I heard from different people I've talked to, some different situations, but there was a tiny fish that was taken out years ago. I think it was a silverfish, and it used to eat at the algae. And it was taken out because they thought it would hinder the bass production of the eggs. Well, it turns out it didn't. And so I could see like children all over this county and surrounding counties developing those fish in their classrooms, coming and taking a field trip, seeing this beautiful lake, and being a part of the change. And what power that brings to a community and to children who will go forth in their life and be able to see that they can make a difference. So I've been told that this would be one of the places I could come and present this. I don't know if this body of leadership can do anything about that, but there might be someone on this board that has connections to someone or people who would be behind something like this, both in agriculture and ecological systems in California, as a response to what has happened in our lives, to have children be the change that's needed in this beautiful state of California. Great. Thank you.
Thank you. So this, for public input, it's not a period for dialogue, but if you want to reach out to any of us, or I can help you connect with some of those resources, and then we do have a conversation this afternoon about a fish in the lake. So if you want to join at 1:15, we'll be here probably for several hours talking about that.
In here at 1:15. All right, thank you so much.
Of course.
Thank you.
Do we have anybody else in the chambers? Would you like to come up and make sure and give your name, and you have 3 minutes.
Hi, my name is Roberta Lee, and I'm also going to talk about animals. I noticed on the closed session you have a public employee evaluation for Lake County Animal Care and Control. So, keeping with the current issues that have been publicized 3 times now in the Santa Rosa Press-Democrat regarding an animal-related issue, I would like to say I've been in the field for years, and I have a lot of empathy and respect for the work that Lake County Animal Care and Control does. I also have some formal legal education. I didn't finish law school, and I realize what they're up against. I also am concerned, though, that we have an ongoing and continuing issue. The public does have the animal purchasing public patronizing stores that have issues. They need to make complaints. I've spoken to Animal Care and Control. I have 100% agreement with Jonathan Aramis that people make complaints online and on Facebook instead of post photos and pictures, and no matter how compelling and disturbing may not meet the evidentiary standard, and they need to immediately step outside, make a call to either Lakeport PD, Animal Care and Control, or as soon as can, and file a formal written complaint, which I have in the past. Moving forward, this is a complex situation, and I'm familiar with some of the parties. I'm not that concerned about the landlord's issues. I'm concerned about the welfare of the animals, and I don't know what Lake County Animal Care and Control can do moving forward. I realize they've had inspection warrants multiple times, but I do think maybe an investigator, they need extra help. I don't know what can be done, but it's a chronic issue. You also cannot discount private Facebook individuals and groups that harassed and threatened the owner and her children, which was turned, I know I sent the post to the district attorney. What they did, I don't know. That was back in April. So I am concerned for the animals' welfare. Again, realizing the very hard work that Lake County Animal Care and Control does and what they're up against with irresponsible pet owners and people that are hand-wringers. Not everybody can do something. So I did what I could. There's California health and safety codes that pertain to pet stores and pet store operators. I think when Jonathan went in with an inspection permit, he could have asked, are you handing out care sheets for each animal? Ask for the veterinary records that are required. I spoke to Annette. She allowed me to examine the cockatoo manual. So I hope something can be done in the future. And it does take the public, not just the government. So I'm understanding of that.
Thank you so much.
Thank you.
Anybody else in the chambers? And it doesn't look like we have anybody in the Zoom room. So we will close public input and move on to our 910 item, 6.2, public hearing, a consideration of adoption of resolution of formation, declaring results of majority protest proceedings, and renewing the Lake County Tourism Improvement District, and B, consideration of adoption of 2024 to 2033 Lake County Tourism Improvement Management, District Management Plan. So would you like to come up here and join us?
Good morning, Board of Supervisors. Thank you for having me back. City and county officials, I really appreciate it. It's been, I believe this will be our final time before you for this renewal of our Tourism Improvement District, AKA Visit Lake County. It's been a long process. We've done a lot of outreach. We've talked to lots of our stakeholders. We've found lots of stakeholders we didn't even know we had. And we feel like we're really in a good place to move this forward. People are excited about where we've come from, and I think everybody is excited about the future of tourism in Lake County. So, oh, and I'm Brian Fisher, Executive Director of Visit Lake County. So I look forward to answering any questions if anybody has any, and we hope that we can get our adoption going today and renew.
Brian, do you wish to introduce Ms. Brown?
Oh, I'm sorry. I didn't see you up there, Emily. You're behind my shoulder. This is Emily Brown. She has been extremely helpful and really crucial in the entire renewal process. Emily works for Civitas, the consulting firm in Sacramento that we hired to shepherd us through this process. And Emily has done an amazing job. This is a very intricate process we found out, and she really knows how to get it done. So Emily, thank you so much for your work. Couldn't have done it without you, for sure.
Thank you, Brian, and thank you, members of the board. I'm happy to answer any questions that you have today.
Does the board have any questions or comments, or do you have anything to add?
No, I think there should be a statement made with regard to the petition and that we can still move forward.
Yes, so when we initially petitioned our stakeholders, we petitioned for a 3% assessment on per room night. Through negotiations, the process, we lowered that assessment down to 2.5%. And that is reflective in all of the renewed resolution that you have there and our new management district plan. So beginning in January of '24, the new assessment per room night will be 2.5%, and it will be in effect for 10 years until 2033.
And is there any reason why this should not go forward?
I see no reason why it should not go forward.
Okay. It meets all the eligibility criteria.
It does. We have passed the weighted vote of our stakeholders. Over 50% have approved it. And as I showed you in one of my other presentations, really the majority of our largest stakeholders have signed on to this new district.
Okay. Supervisor Spatier?
Thank you for this. Glad it's the long process may come to an end here. I appreciate you mentioning the 2.5 and reducing it to 3. I know that it's in the plan, and we're supposed to approve the plan. It doesn't necessarily mention 2.5 in the resolution, but it does mention the plan. I just kind of wanted to double check and make sure that we don't have to bring the 2.5 into the resolution since there was a change.
I will defer to Ms. Brown on that.
So the resolution is just requesting the board's approval of the management district plan dated December 7th, and that is the plan that has the updated assessment rate of 2.5%.
Okay.
The short answer would be no. The resolution would not need to include the updated assessment rate.
Okay, just wanted to make sure, just in case, because I know that we started the protest hearing with the 3%, and obviously with the updated plan, this is enough. Just wanted to make sure. Thank you.
Mm-hmm. Any other questions? Supervisor Green?
Yeah, thank you. Appreciate bringing this forward. Excited that you're moving forward with this. The plan does note several of the marketing strategies you use. I'm sorry. Got it right here in front of me. But specifically, the use of online advertising is kind of central to your strategy moving forward. So I see growth in Facebook attention and stuff like that. And I think in previous presentations I've heard you make, probably before the city, we talked a little bit about that. So some of that may involve remarketing, advertising to people that would get an exposure to a cookie and then come back and get exposed through advertising again. Okay. So I don't see much granular detail in this plan about how we handle these various social media platforms and stuff like that. So there are things in here that I really, really like: professionally produced newsletter, print ads, stuff like that, some of what I call old media. And then this new media is still kind of an evolving thing. So I just want to highlight that I don't see a lot of specific detail in this plan about what exactly we're doing for online advertising. Personally, I distinguish between simple ads and remarketing techniques, basically because of the use of cookies that do tend to track people, whether it's personally identifiable or not. I don't care much about that. I just don't like the idea of tracking people for advertising purposes. So it's just a comment and a suggestion that maybe we can fine tune some of that, make sure that the website is fully compliant with both federal and state laws relating to online privacy practices, and that's just it. I want to congratulate you for a very thorough approach to this, while also expressing concerns about the use of remarketing. Thank you.
Thank you, Supervisor Green. Retargeting is what the process you're talking about, and that has changed a lot even in the last 4 years since we've been marketing outside of the county, primarily because of the way Apple changed their operating system. They no longer let somebody just be remarketed to. Any website you visit, it has to ask you if you would like to be cookied, basically. And so that's changed everything, and that's why you've kind of seen actually Facebook earnings have difficulty, because they were doing so much retargeting advertising that kind of took the wind out of their sail for about a year. So things are not as, it's much harder, and that is just not generally accepted practices anymore. Somebody has to opt in to be remarketed to on most operating systems these days. So, but I appreciate your concern, and yeah, we use a lot of digital advertising. That's definitely where we're going to be spending the vast majority of our funds this year. It's very effective for us.
Okay. Any comments from the public? Seeing none in the chambers or in Zoom, we'll bring it back to the board for action.
Madam Chair, I offer the resolution of formation declaring results of majority protest proceedings and renewing the Lake County Tourism Improvement District.
All right. Supervisor Simon?
Yes.
Supervisor Sabatier?
Aye.
Supervisor Crandall?
Yes.
Supervisor Green?
Aye.
And Supervisor Peisel?
Yes.
And with that, I move to approve the adoption of 2024 to 2033 Lake County Tourism Improvement District Management Plan.
Second.
We have a motion and a second. All in favor?
Aye.
Aye.
Any opposed? No. Thank you.
Thank you very
And
much.
thank you for dedicating so much time to this process. It has been a labor of love. Susan and I have been along for the ride, and we appreciate your excellent team and all that you do, and we look forward to the next 2 years, bringing more
thank you.
people into our county.
Thank you very much. Thank you, everybody.
One
Thank you,
more
Emily.
comment from,
One last comment.
sorry.
You know, one more step. When I first came on the board, you know, and made the comment here quite a few times, telling our story. This is another step of telling the story of Lake County and who we are. So
Totally.
greatly appreciate it, and we'll continue the growth.
We'll
So
keep it rolling.
we're here to work with you. So thank you very much.
Thank you, everybody. I really appreciate it.
all right, good job, Brian. Okay, our next item, 6.3, 915, is Lake County Health Services Public Health Update.
Hi, this is Carl Sporty, your interim public health officer. And I believe I have Philip Wagner coming up to the podium.
I'm here.
Very good. Thank you for the time and ability to speak today. Jonathan Portney is still on paternity leave. And I want to introduce Philip Wagner, who's our new Director of Nursing in the Public Health Department. Jonathan and Philip have worked very closely to reorganize and create the new organizational table structure for the Department of Public Health, and have done a lot of work in sort of rehiring and streamlining things, developing a COVID response for the future. And Philip's going to talk a little bit about what they're doing and his perceptions of what's going on with COVID nowadays. Thank you, Philip.
All right, thank you. Well, I'm new. I came from Wisconsin, and I thought I left the cold behind me. But it seems there's a bit that followed. I have a bachelor's degree from Seattle Pacific University in religion, Greek, history, and English literature. A bachelor's in science from the University of Wisconsin, Oshkosh, where I'm originally from, in nursing, and a master's in public health from the Liverpool School of Tropical Medicine. I've worked and traveled in 55 countries, and I must say I'm very glad to be here and to be a part of this community and to learn from you and to help any way I can. A little bit about COVID-19. Officially, you might have heard on the news that the emergency ends on May 11th. Well, that's not the end, of course, of the disease, but we've seen and we kind of act like it's all over. But we're going to have to live with a new reality. That reality may be continued vaccination, like influenza, like flu, diseases like tuberculosis, and other things. We'll have COVID for a long time. It still reminds you that it is still the third leading cause of death in the United States, behind cancer and heart disease, but ahead of pneumonia, diabetes, accidents, stroke. So it's still a very important thing in our health system. There's a higher percentage of people dying who are marginalized, who are immunosuppressed, and that probably will continue. The Biden administration has a plan to continue vaccinations to the most vulnerable and needy, and the health department will be a part of that. Looking for the danger of new variants. You hear all kinds of things about new variants. To prevent shutdowns in education and in the economy, and to vaccinate the world. So that's the grand plan post-emergency. For our organization, we will continue to have COVID funding through 2014. And that means we will focus on the areas of the marginalized and people that really need it. It also means that we stop testing on February 3rd, and we'll stop the free vaccinations on February 28th. So anybody who needs a free vaccination, get it before the 28th if you want it free. As a health department, we are reorganizing, like Dr. Spohr said, and we have a new organizational chart that we'll be putting on the website as soon as we can. There are some new hires. I'm one of the new hires, Director of Nursing. We have a new Health Services Program Coordinator, Judy Garcia, a new Health Programs Coordinator for Health Equity, which is an important thing in health, Layla Romero. We're looking for an epidemiologist, and we're looking for more nurses. We need a lot of nurses. The heart of public health is nursing, and it's been that way since the early 1900s. So I need some more nurses. Anyone who knows a nurse that needs a job, wants to work in a great system, public health, please see me. And that's all.
Well, thank you both and welcome. Thank you for choosing Lake County. We're delighted to have you.
Thank you.
Dr. Spohr, did you have anything else to add?
Not a lot. This winter, we worried about the triple pandemic, and we were lucky across the country, and particularly lucky in Lake County. RSV didn't hit us too hard, and it hit the rest of the pediatric hospitals pretty hard for the early months of November, and sort of dipped and went away after December. Flu was milder than usual, earlier than usual, and COVID, we've been fortunate this time. Philip is right, though. We're going to have to worry about COVID the rest of our lives, and our new COVID unit is going to be on top of that in our community. Thank you.
Thank you. Anything from the board? Any questions from the chambers or the Zoom room? I'm not seeing any. Okay. All right, well, thank you so much. Really appreciate you both being here. And we'll look forward to our next presentation.
Thank you.
So moving on to our 6.4 item, 9:30 in 1 minute. Almost there. It is now 9:30, and we can move on to our presentation of report of the Roadmap Task Force 2022 activities. We have community development and our sheriff. If you'd like to come up and join us. Do you want to come sit up here?
Actually, good morning, Mireya Turner, Community Development Department. Our code enforcement staff is away at a training, and I inadvertently requested the item to be placed on this date, but I'm now requesting that it be carried over to February 14th.
Okay. Does that work for February 14th? Maybe the 28th?
We're open to the pleasure of the board.
I recommend the 28th.
Yeah, I think the 28th would probably be better.
I think that I just wanted to make sure the sheriff's office is available. This is quite a collaborative effort between our two departments. Good. Thank you.
Okay, thank you. Appreciate that. So we can take up some of our untimed items until we get to 10 a.m. Is there one that you recommend right now?
I would recommend 7.3 to begin with.
Okay. Okay, item 7.3, consideration and discussion involving the recruitment process for filling the vacancy created by the county council's retirement announcement. I know.
Oh, I was like, what's all the noise?
So I will pass this over to admin.
Yes, thank you very much. In the memo that was provided to your board, there are two types of recruitment. One is promotional only, which is a 5-day recruitment used to establish an eligibility list in which qualifications for the application is limited to current, permanent, and extra help employees in county service. The second option recommended is open recruitment. It's a 10-day recruitment, which is a competitive process used to establish an eligibility list in which any qualified applicant may participate. And it's up to your board to discuss and make a decision and direct staff.
I'm just curious if there are any recommendations from staff.
I would recommend, if you're asking for my personal recommendation, it would be open recruitment. And one of the reasons is because we may get applicants from outside of the area. You're not obligated to choose anyone from outside of the area, but it also gives us a short list of possible employees for other positions within the county council's office. Just a thought.
Okay. Okay. Questions from the board? Comments? Supervisor Sabatier.
Thank you very much for bringing this to us very quickly so that we can make sure to get through the process and have the chance to make a good decision in the interviews that we'll have. I also believe that open application is the best way to go. I have great respect for the lawyers that are in the county council's office, but I think that for any time that we're opening up door for a new director, we need to open up the door entirely, and so looking for open application for me.
Supervisor Green?
Yeah, just a question really quickly. Sometimes there's a third option, like when we have hard-to-fill positions. Like open, great, but still only a 10-day recruitment period is not huge. So on a good recruitment, we would have a bunch of applicants and do some interviews, but a lot of these upper-level positions are kind of hard to fill. So when do we distinguish between when we just want to do a promotional or open recruitment and when we want to take more aggressive steps for recruiting? I consider this one a very critical hire. So of the two options presented, I'm going to lean toward the open, but I'm wondering if a third option has been considered.
Pam is on the line.
Good morning. I think we would do an open recruitment and see what we get in 10 days. And then if we don't have a robust applicant pool, then we could look at other options such as a recruiter. But I don't know that a recruiter is necessarily going to help drive in it. When our last two hires just took a number of times to find qualified applicants that met the needs of county council. So attorneys, the last class, I think Anita said, had a 28 or 30% pass in the last year. So it is going to be hard to find a applicant, and I'm not sure that a recruiter is going to necessarily help that, but we certainly could cast that net after we see what our applicant pool looks like.
I think that your board has traditionally now for quite some time always gone with open recruitment, so I would never suggest you do otherwise. I do think that if you advertise in the places where people who want to be in county government, county councils are looking. I think you'll get a pretty good selection that way. I understand the comment about the bar passage rate, but I doubt very much you want somebody who's been an attorney for less than a year in this job. Though I suppose, no, I doubt very much you'd want somebody, but I mean, that's up to you, but I would doubt it. But I do think that people who want public service look for particular advertising spots, and I think that will generate quite a bit of interest.
Any other thoughts from the board? Okay. Public, oh, sorry. I thought it was still up.
And I was going to mention something similar. I'm hopeful that HR will be working with County Council to make sure that we do advertise in the appropriate places so that that net is not just cast to the millions of people who are not lawyers and who are not eligible, but to specific groups that would be eligible for that position. So just wanted to make that comment.
Okay. Anyone in the anyone from the public? Don't see anybody in the chambers or in the Zoom room. So I will bring it back to the board. I agree. I think that open recruitment is the way to go. We just start that process. And if we have to do it again or make changes, we can do so if we need to. Okay.
Consensus should be good.
It says approve the open recruitment.
So I think we're all in agreement. Option number 2, open recruitment for the 10 days, yeah.
Okay.
Thank you, board.
Okay. Which one next?
7.6.
Okay, consideration of the following advisory board appointments. Clerk of the board. Looks like we have Child Care Planning and Development Council, Emergency Medical Care Committee, Law Library Board of Trustees, Maternal Child Adolescent Health Advisory Board, and the Middletown Area Town Hall. Start at the top, Supervisor Sabatier?
Oh, sorry.
Or who's starting?
I'll speak for the Child Care Planning and Development Council since we're starting at the top. Samantha Bond is the Executive Director of First Five. I think it makes perfect sense for her to be reappointed to the Child Care Planning and Development Council.
Okay. Any other comments? Anyone from the public? Bring it back to the board.
Madam Chair, I move to approve Samantha Bond to be reappointed to the Child Care Planning and Development Council.
Second.
A motion and a second. All in favor?
Aye.
Aye.
Opposed? Motion passes. Okay, Emergency Medical Care Committee. Supervisor Sabatier?
Madam Chair, I'd like to push this one for further discussion. In reviewing the two applicants, one of them does not define a specific category which they would fit in. One does, but I don't think a resident who is not involved in some form in either a nonprofit or an agency that is related to emergency medical care, because consumer interested group to me does not mean a resident volunteer that wants to provide feedback. I think that's still a group that's related to providing care and providing service within the realm of emergency medical care. So at this moment in time, I'd like to pull those two applications, have further discussion with the EMCC to make sure that either this is appropriate or inappropriate.
Okay, anybody else? From the public? I don't see anybody in the chambers or in the Zoom room. So do we have consensus to wait on this? Yes?
Yes.
Okay. All right, we'll move on to Library Board of Trustees. We have one vacancy and one public member. Dennis Fordham.
I'll go ahead and move forward with it after public input. He's been on. He's a good reappointment, so.
Okay. Any comment from the public? Okay, I'll bring it back to the board.
Madam Chair, I move to appoint Dennis Fordham to the Law Library Board of Trustees.
Second.
We have a motion and a second. All in favor?
Aye.
Opposed? Okay. Maternal, Child, and Adolescent Health Advisory Board. We have 6 vacancies. General membership, Samantha Bond, reappointment. Supervisor Spatier.
Same message as earlier. Samantha Bond, being the first 5 executive director, makes perfect sense to reappoint her to Maternal, Child, and Adolescent Health.
Okay. Anybody from the public? Okay, bring it back to the board for action.
Madam Chair, I move to approve Samantha Bond to Maternal, Child, and Adolescent Health Advisory Board.
I'll second that, but then follow it with a question. So just like we had a question on categorization of the seat, are all the seats on MCH general membership, or are there some organizational seats in there as well? Because she would probably fit better into an organizational seat than a general membership. And I don't need an answer right now, it's just a question. I don't know the composition of the full advisory board.
It's all general membership.
It's all general membership, okay.
Okay.
Then
I think
second.
we have a motion and a second. All in favor?
Aye.
Any opposed? Motion passes. We have Middletown Area Town Hall. Monica Rosenthal, reappointment for proper seat number 1. Julia Bono, alternate. William Waite, alternate.
Yeah, at this time I'll be reappointing Monica Rosenthal and also Bill Waite, or William Waite, to the general membership.
Any comments from the public? Seeing none in the Zoom. Bringing it back to the board for action.
Madam Chair, I move to appoint Monica Rosenthal, reappoint Middletown Proper Seat 1, and also Bill Waite, alternate general membership.
Second.
We have a motion and a second. All in favor?
Aye.
Any opposed? Motion passes. Okay. What would be next now? We still have 15 minutes. Yes,
Like the last one.
7.7? Yeah, we'll do that. Okay, 7.7A, consideration of creation of Section 19 of the Board of Supervisors, County of Lake, California Policies and Procedures Manual, and B, consideration of approval of Section 19.1 acceptable use policy. And do we have our director with us? Okay. Okay, we'll come back to this item. And
You can try 7.2, since we have 15.
okay. Item 7.2, consideration of discussion and action regarding short-term administrative support for the monthly Risk Reduction Authority RRA meeting from our admin office.
So I can introduce the item, obviously, from Lake County Risk Reduction Authority. We, at the Lake County Risk Reduction Authority, obviously NCO isn't going anywhere, but we were informed that they were unable to continue with our support services for the Lake County Risk Reduction Authority. Obviously, they've got some other projects that are happening in Lake County, but they've also had some losing some employees in this vital area. So what we're coming today is to ask for some short-term support from our administration office. It'll take up more time, the allotted time, than just helping, helping out. So we need to get that approved from the board. Susan can help talk about it, but we do plan on doing an RFP or coming up with something in the near future for long-term support of the agency. There are conversations going on, but we're probably looking at, and I think we talked about 6 months support just to be, so we're not coming back every 90 days if something takes a little longer than we expect. So that's really the gist of it. We need board approval. So hopefully we can get that today, but that's why we're here for the discussion. And Susan or Jessica, I'll turn it over to you to follow up.
Yes, it won't be a full administrative support. We're just going to do basic agendas and basic action minutes. So it may not even take the full 15 hours a month, but until I would like to recommend to the board, to the RRA board, that they either consider retaining a temporary agency for clerical assistance and or go out for an RFP or even publish and advertise for the position.
And we do have a meeting later this month, and we are having conversations, so it is something that we are prioritizing. It just kind of came up on us suddenly, and so we were making this request of the board.
A little bit of history also, when we put in for the Cal OES grant, the Climate Resiliency Grant, in our first iteration of the grant, we had written in not only a climate resiliency officer, but also I don't know what term we used, but an assistant in that position. We were asked to remove that at that time. We were hoping that, that assistant would also be able to help in some support of the RRA. And what we had talked about from admin with the previous CEO when we were going through it was there would be a little bit of support that would come from the admin office. I don't know exactly in what position that was or iteration that is now. But we just need this gap. We did have the conversation with the NCO with their folks leaving the department or their organization put us in a challenging spot. So we did the 6-month contract, which just ended this month. This will be the first month that we need to pick up kind of the minutes and the posting of the agenda, and we'll work diligently to get that position filled. So we shouldn't be coming back to the board on a bigger approval process because the contract was supported not only by our cannabis funds that we had put in from the county and also each district supervisor, myself and Supervisor Paiska, but we are also looking at coordinating those opportunities for distribution or support from each agency that is joined. So that's where we're at this point.
So there is funding available.
Yes.
That's not the issue. It's just we need the staff support. Supervisor Crandall?
Just a thought, I know it says, let's see, I think you mentioned that the temp agency or RFP, is there a thought about like a 900-hour person or something like that, or is that not ideal? Like extra help, or would that be not ideal?
I was trying to separate the county from the authority.
Oh, okay. Makes sense.
Yes.
Sorry.
That's all right.
Yeah, so that's the conversation the RRA is having. Should they go out with an RFP? Should they hire? Who should they hire? So we just need this kind of gap support. Supervisor Spatier?
Thank you for bringing this for discussion. This has been a concern of mine for a while. I know that staff has already been working a lot with RRA. I know staff helped out with the budget and amongst other things. And I'd like to get a clarification. There was a 6-month contract, and that contract just ended with NCO?
There was a...
Or did they pull out
No,
earlier?
they finished their contract.
Yeah.
So the surprise then was that they weren't planning to renew the contract?
Correct. We had anticipated that they would be renewing the contract, and then they had some immediate staffing shortfalls, and they just weren't able to continue. and renew the contract.
Okay,
So it was a surprise.
Yeah, they lost both employees that were supporting. From my understanding, they lost 2 that were supporting our, they moved on.
I'm concerned about using staff capacity for a non-county task. And I'm concerned about what door that opens up about others potentially requesting similar requests. I mean, you've mentioned minutes and agendas. What else exactly would this consist of?
We're limiting it to that and that alone.
Yeah, so previous to having NCO do this work, it was carried by admin. It was carried by Michelle Scully. And with her transition out of admin, we put the RFP out for support, and that's how we first entered into a year contract with NCO and then a 6-month contract. And so we've lost that support. I feel really confident that we have a plan. It's just we haven't talked about it yet at the RRA. So we are definitely working on it. We wanted to make this very, very short term because we have the options. If nothing else, we can go out to the short-term agency. We can't do that. It's just we can't do that this month because we haven't had our meeting yet. So the funding is coming in. We feel stable there. We just need a short time gap filler. And it's only minutes, only agendas, nothing else.
And posting of the agenda.
And posting
of the agenda.
posting and
minutes,
emailing.
Yep, that's it. There are no other committees. The other committees that they were working on have been moved, either postponed at this point or moved into to different areas and brought back into the county, at least the forest, what is the?
It was the CMAT and all of those yeah, it's just, NCO was supporting several committee meetings, and that is not the case any longer. It's just for the one meeting once a month.
Yep.
Okay. And then who will be working on the RFP?
Well, we don't know if there's going to be an RFP yet because we don't know what the board is going to decide. Or that we don't know what the RRA board of directors is going to decide.
I know Anita has a comment.
Oh, thank you. I was just going to say that when you have a joint powers authority, it's not an unusual situation that for stopgaps, one member may fill in certain functions on behalf of the entire membership, which sounds like is what's happening here. The county as a member is going to fill in certain functions, and they did do it initially. The county does that in certain other circumstances. PSA 26 is an example where the county is a member, but they perform certain functions that are above and beyond just general membership. Generally, in those circumstances, the other members find a way to also participate if anything goes on for very long. But it happens with a joint powers authority from time to time.
Any comments from the public? Okay, seeing none, I'll bring it back to the board.
Do we need a motion or is this direction?
Oh, it's just direction? I think there's a recommended.
And if you don't mind, if I can just make
Sure.
a final comment before you move on, Supervisor Simon.
Go ahead.
So I know that I've been hoping and pushing for a clear situation between the county and the RRA, because it just always seems like there's this gray area, which one's the county and which one's the RRA. I feel that there are a lot of people involved in the Risk Reduction Authority. I know I'm on some committees where I create the agenda and I do the minutes, and I think that that can be handled from the RRA. I'd like to see it moving in the direction of independence, which is the direction I was hoping to move forward with, and I thought it was a great step in making the The memberships provide funding to help keep it going, but now I got to ask what, I guess that funding's on hold until further notice. Hopefully the RFP is what the board wants to do. I know we've asked and tasked our administration office with some very important tasks, and I do not want to see them be deviated. And I think that this is something that the RRA, in meeting together, can possibly figure out how to create that stopgap in between losing NCO and gaining a new lead agency. Just wanted to explain myself rather than just providing you a vote, but I'm ready for the vote when it's on.
Thank you, Supervisor Sabatier, and heard loud and clear. So we'll be working on it. Ready to go?
Okay.
I need some help drafting this one. I don't see. So it says direction to staff on the memo, so I just want to make sure. So I would like to make a motion for short-term support for administration functions from the admin office for the Lake County Community Risk Reduction Authority.
Second.
Okay, we have a motion and a second. All in favor?
Aye.
Opposed?
Nay.
Okay, motion passes. And we can go back to 7.7. All right, consideration of creation of Section 19 of the Board of Supervisors, County of Lake, California Policies and Procedure Manual, and B, consideration of approval of Section 19.1 Acceptable Use Policy. Director French.
Good morning. Shane French, Information Technology Department. For your consideration this morning, we've been working in our Technology Governance Committee on some new or updated policies surrounding information technology, information security, and the like. What we have here for your consideration today is an acceptable use policy. The county has not historically had a acceptable use policy. We've had a document that was, I would almost call it like a quasi-policy that has been in use for many years, called the Internet Use Agreement. This is designed to replace that, and it's more in line with the typical acceptable use policy you might see in an organization our size. Some of the things that it covers, of course, is the acceptable use of county resources, information technology resources, and the like. It gives users, and when I say users, I mean county employees, volunteers, contractors, anyone who's using our systems internally, these would be applicable. But it gives them guidelines as far as what kind of conduct is appropriate. It crosses over a little bit into security concerns. There will be a little bit of overlap with a planned future information security policy, but it tries to cover all the bases that information, or rather that Internet Use Agreement covered, but to modernize the language and modernize the requirements to ensure that we don't violate copyright, for example, don't violate laws, and also ensure that information is handled appropriately and that we don't cause disruptions to others in our use. So that's what I have for you. The other piece of it, of course, is that what we kind of like to do is have a section in our county policy manual that encapsulates all these information technology related policies. Right now, we kind of have a separate document, like I said, for our current quasi-acceptable use policy. And, our information security policy is a completely separate kind of adjunct document. So what we'd like to do is create a policy section called 19.1, it's the next number in the policy section, that would be incorporated into the overall employee policy manual. So that's essentially what's up for your consideration today.
Okay, great. Supervisor Crandall?
Just a quick question, it probably is in here. Does this apply to Zoom as well?
Yes.
Okay, good. That covers my question because everything's written in here. Thank you. I've had situations where a couple of things have come up and these policies will help. Thanks.
Supervisor Sabatier?
Thank you for bringing this. Sorry we had to delay last time. I know that I spoke with Director French about potentially adding something, and so I just kind of wanted to read out what I would like to add, and it would be under 19.1.8, under confidentiality/authorization. I would like to add a section 19.1.8.5 saying users must only access those systems with a password-protected device. If user finds that they, where is that example? If user finds that their device is not password protected, they must inform their supervisor so that the problem can be corrected. That's what I would like to add to that, just because it's so easy for people to want to get past the password protection by making it automatic, but that opens us up to potential issues if devices are not. So just, I know Director French did mention that there would be overlap, just like he mentioned earlier, with the security policy, but I think it's important within the network policy to keep reminding people that we use password-protected devices only.
Okay, Supervisor Green?
Yeah, thank you for bringing this forward. As I'm going to consider it a first step, but and thank you to Supervisor Sabatier for that addition. So the term county information systems is not defined in this, and I think you and I have talked previously about trying to get my head around where our assorted desktops and tablets begin and where our employees' personal devices end, and the increasing overlap between the use of personal devices in the county workplace and our use of whatever county information systems are that somehow represent this marriage of county funded and installed and monitored technology and this somewhat looser system of technology that is not installed or even accessible in many cases involving our personal devices. So what I see here is acceptable as far as it goes as far as an acceptable use policy. I just can't really define on the plain face of this the full breadth of which this policy would be applied, how our employees would understand it in terms of their daily usage of technology in the workplace, whether it's, again, from county-initiated systems that are sitting right there on the desk, or a little smartphone that's following them around inside and outside the office. So I don't know if this is the actual policy I should be focusing on those questions, or if it's more of a security policy concern, but I just thought I would ask the question starting with what is the definition of county information systems to which this policy would apply?
Yeah, so I mean, I guess we could go in and make a concrete definition within the policy for that if it's helpful. You know, to me, again, this is supposed to be a guideline document, and there is some overlap with information security concerns. However, I mean, to me, it's any system that is in use for the purposes of doing county business, right? So if you're on your personal device and for whatever reason you have it set up to access the county email, for example, that's a county system in the sense that you're accessing that system. But obviously your personal phone wouldn't be a county system. So I'm not going to really care what you do on Facebook on your own personal time, obviously, and this policy would not and could not possibly apply to that. So, I mean, it's one of those things, I mean, I guess if it helps to have that definition included, we could certainly work on that. I might have a little bit of a hard time coming up with a truly concrete definition because of the overlap that you mentioned.
Supervisor Crandall?
Yes, I have a question, and I think, Ms. Grant, you might be able to help me with this. On 19.1.11, penalties, this is basically stating what happens if someone breaks this policy, right?
Yep.
Okay. I wanted to see if it says all county employees and contractors are expected to abide by these policies, and at the top it states, what is it, volunteers? Is that, what is consisted under volunteers, like advisory committees, things like that?
Well, yeah, certainly certain departments have volunteers that access certain county information systems, right? So this would be anyone that accesses county information systems you know, especially any kind of like a line of business application that we might have to support that business application.
Okay, like, and what I mean is like max, if they're like using something that has to do with, as a volunteer basis on a max, does this apply or no? Town halls, volunteers that are on those.
Sure. I mean, I suppose if they're using a county information system, it would apply to them.
Okay, then they wouldn't be using that. They'd just be using something like Zoom or something like that. It wouldn't be even, okay.
But if there were a circumstance where there were other users, the policy could simply be amended to reflect that. And generally, in those cases, the corrective action is just they're denied further use.
Okay. Okay. All right, thanks. I'm just looking at if someone on the max uses it to basically put the county in a position to not have control over whatever the case may be for that specific MAC, I'd like to see something in there if it applies to, on 19.11 for penalties, that they would have some sort of consequence, like immediately removed or something like that. But I don't know if it applies.
I don't think it does in this case, does it?
No, and I do think that, like I said, I mean, corrective action is fairly ambiguous, but is encompassing in the sense that, you know, corrective action could be, hey, you don't get to participate in this anymore if it's a truly egregious violation of the thing, right?
Yeah. All right, thanks.
But the provision as drafted only applies to county employees and contractors, so that interpretation would only be extended to them.
I just noticed in the top it said volunteers, so I
Yeah.
thought maybe it did, but okay.
Well, and county volunteers, this may be,
On the county level.
That's kind of what the intent was, yeah.
Okay, thank you. I'm good.
it may be, that may be an issue that the county and IT want to consider further then in terms of volunteers, because a volunteer would not be subject to discipline. Of course, neither would a contractor in that mechanism. It might be better to just simply add after termination of contracts, or I don't know if denial of service fills that gap in terms of that language, or...
Well, we tried to be, you know, have this be as broad as possible so that we were covering all the bases, but of course, there's a lot of bases to cover when you have volunteers and contractors and, you know, employees and so on and so forth. But, I mean, I think in this case, obviously, it's totally up to you if we want to add some language to this, but I really do believe that I can't foresee a situation where, you know, basically other corrective action doesn't cover it.
It's really not, yeah.
It's not the other corrective action that doesn't cover it, it's the all county employees and contractors that doesn't cover volunteers. So what you may want to do, county employees, contractors, and county volunteers,
Sure.
And then you've covered it all. Supervisor Spot.
So at the top, it already puts all of those into the category of county users. And so if maybe we just use the language county users at the bottom, then it fulfills whoever is utilizing and whoever was given access to information systems.
That would be a perfect fix.
Yeah. Thank you. And just I wanted to reply to Supervisor Green's comment. I feel in rereading, it talks about what we're providing to a end user in order to be able to function in the work that's requested of them. And that includes everything that's made available to them. And so to me, information systems, it'd be difficult to identify specifically because it's always an ever-changing situation. But if you read the entirety of it, I think it describes it pretty well. It's what you're given access to in order to do the function of your job that you've been employed to do, contracted to do, or requested to do. So I think I'm comfortable with the way that it is currently.
Okay. We have a hand up in the Zoom room. Betsy Kahn, you have 3 minutes.
Betsy Kahn for the Essential Public Information Center. Thank you, Madam Chair, and thank you, Board. I'd like to make 2 comments. First of all, as a former volunteer for one of your departments, I had to sign an employee agreement that gave the authority to the department head to ensure that I was following all of the rules. And I don't know if that has changed in your personnel practices and policies, but I think you should just make sure all your volunteers have that agreement. Secondly, Mr. Crandall referred to a question about the municipal advisory councils, and I would like to recommend that you adopt a policy for municipal advisory councils similar to what the county of Mendocino has. That policy is available online, and that would be the place where you could insert information about the users, the board members, and so forth, to direct them as to what their responsibilities are. Thank you.
Okay, thank you. Any other public input? All right, I'll bring it back to the board.
Just wanted to ask the rest of the board their thoughts on the amendment.
I'm in agreement with the amendment,
Yeah, I'm fine.
or amendments. I know there was a few different comments made there, but
The
adding the
users?
language to cover the users,
Yeah,
yes.
Chair Pyska, so what I'm hearing is the kind of addition to the section that you mentioned in 19.1. I guess it would be 8.5, I believe.
Correct.
Yeah. And then we're changing the language at the very end here under penalties to just change it from saying all county employees, contractors to county users. Okay.
So there's an A and a B. Aren't we just approving one thing?
Well, you're kind of potentially approving two things. Again, this section 19 does not yet exist, so what we're asking is that you allow for the creation of the section 19 that will be applicable specifically to information technology concerns.
Okay, and I have a feeling I could do both in one motion, so I move to approve the creation of Section 19 of the Board of Supervisors, County of Lake California Policies and Procedures Manual, and add Section 19.1, Acceptable Use Policy. As amended, thank you so much.
Second.
Motion and a second, all in favor?
Aye.
Opposed?
No.
Motion passes.
Thank you.
Thank you. Shane?
Chair Pyska.
Yes?
Yes, I just want to respectfully request that we move 6.5 to 228.
Yes.
And then you may wish to take up 7.4 and 7.5, since behavioral health has been here since this morning.
Okay, we will move item 6.5 to the 28th.
228, yes.
Okay. And,
Can we take a short break?
yes,
Or take a short break.
we'll take a short break, so we will come back at
Sorry.
10:20. On what? The opioid, honey?
Yeah.
Yeah. We ready, Sam? Okay. 7.4. Okay, yes. Thank you. 7.4, consideration of resolution authorizing the Behavioral Health Services Director to sign the Drug Medi-Cal Organized Delivery System Regional Model Implementation Plan and submission to the Department of Healthcare Services. Director Metcalf.
Good morning, Board. Todd Metcalf, Behavioral Services. I'll let you jump in and introduce yourselves when I'm done. So we've talked about this before. As your board may recall, we brought this forward to you a few months ago, and what this resolution, if approved, will allow us to do is to join the Partnership Health Plan Drug Medi-Cal Organized Delivery System model. This model, as we've explained before, is comprised of other counties, and which is a good thing because this way we can maximize and expand substance use disorder services to those folks in need. So your approval of this resolution today will help us move forward with this implementation plan that is in your board packet. And I don't know, April or Elise, if you want to add anything to that, in case I missed something.
Happy to answer questions.
April Gambra, Lake County Behavioral Health Services Deputy Director. I just wanted to add that this is one of many phases that we have moving forward, and the implementation plan is partnerships. And so we were able to add feedback and guidance and work in collaboration. The next phase is a readiness review in which we partner with Department of Healthcare Services and partnership. And so we're hoping to get that underway within the next week or two.
Yeah, we're still hopeful of a July 1 implementation date.
Supervisor Pyska, Sabatier? It's not my blood sugar because I just ate.
Just a little awkward.
That was awkward.
Thank you for bringing this to us. Definitely lots of moving parts in order to get to the July 1st implementation date. Just kind of a clarification on what this does. I know we're talking about a regional model as well to take part in. I don't know if Trinity's already joined or if they're looking to join, but I know they said in there that Trinity and Lake did not join originally, and now we will be. From what I understand of becoming a part of this ODS is it allows others to take part in providing similar services together. That way it opens up the realm of possibilities for people to get a service from different locations. Not only does that open up the door in Lake County for those services, but it also opens it up in other counties that we will now be a part of that regional group.
Correct. That's part of the maximization and expansion of services. Strengthen numbers.
I will look forward to seeing what it looked like before ODS and what it looks like after ODS, because that's a huge interest of mine, just to make sure that we are benefiting the most from doing this. I know this was a tough conversation to bring this to the board in the first place, but I think we need to keep an eye on those things just to see if are we getting exactly what we anticipated. I know there was some concerns from behavioral health services that were expressed during some of those meetings on potential negative repercussions to behavioral health and the revenues. Can you speak on that? Is that something that you've discussed and looked into, and that those concerns still exist, or are those concerns no longer there? Just kind of curious where we stand now as those conversations continued and progressed.
Do you want to take this one?
Sure. If I'm being completely honest, in which I know no other way, there are still concerns. And we have a responsibility to the board and to all of our Lake County residents to ensure that those concerns are addressed. And so we have a meeting actually tomorrow with partnership, and we are revisiting counties that are currently participating in the regional model, because the concerns go beyond fiscal. As a county, we don't delegate, or we're unable to delegate the responsibility of the model. And so there are concerns about the ability to monitor and implement, and we're vetting those concerns currently.
And in addition to that, do you think CalAIM might help in alleviating some of those concerns to ensure that there is communication between agencies, that there is continuity of care, things like that?
Happy to take that question. So, as you may be aware with the CalAIM initiative, part of it is we're building the plane as we're flying it as a state. And so some of the areas of CalAIM and how they will intersect with ODS remain unclear. Of particular importance and consideration is payment reform. Payment reform is one of the major initiatives for behavioral health under CalAIM. And that process of rate setting, setting our rates with the state for various services and also rates with our contractors is happening right now. And the timing is less than ideal to understand exactly how all of that will roll out because the payment reform is also effective July 1. And so it is a serious concern that we have given those uncertainties with how all counties are navigating this payment reform process together. So in short, I don't know, and we need to look at that very carefully.
And so my final comment, and I guess request, is I don't know that I see anything in here that says that you'll be reporting back to us on how ODS is doing. If we can maybe implement a request to come back either annually or whatever you think is a good amount of time to figure out how things are going, because it takes time when you implement something from scratch. But I'd love to keep an eye on it and keep track to make sure that we are seeing the benefits and that the hardship doesn't overwhelm the benefits.
Absolutely. You haven't heard the last of this yet.
Okay. I will open it up for public input. I don't see any in the chambers or in the Zoom room, so I'll bring it back to the board for action.
For the resolution.
Supervisor Simon?
Yes.
Supervisor Sabatier?
Aye.
Supervisor Crandall?
Aye.
Supervisor Green?
Aye.
And Supervisor Pyska?
Yes. Okay. Motion, or the, yeah, that, sorry. I need to get back to my. Okay, so then next, item 7.5. Get to it.
Musical chairs?
I'm actually going to step down. I'm going to turn it over to, well, I'll let you introduce yourselves, but I'll just be in the way here. And Matthew said he was going to help us with the,
It's coming up.
he's all over
Sure.
it. Okay.
Well, let me just
And we
read
have
that.
two.
Yeah, let me just read the item before we get there. A, consideration of presentation on the Lake County opioid settlement funds by Lake County Behavioral Health and Health Services Department. B, approval to use a portion of the funds toward the match for behavioral health continuum infrastructure program round 6. And C, board and public feedback regarding proposed uses for funds. Okay, now.
Thank you so much, Board. It's a pleasure to present on California's opioid settlement fund this morning. My name is Elise Jones. I am the Deputy Director of Administration for Lake County Behavioral Health Services, and I am joined here by Kim Tangerman, who is with Health Services, April Gambra, Deputy Director, and Christine Andrus, our Fiscal Manager. Matthew, if you could please advance the slide. Thank you so much. So, we are in the midst of an opioid crisis in our country. That's not news. But there was a settlement reached with regard to that crisis to the tune of about $26 billion. And of that $26 billion, California will receive approximately $2.05 billion of this settlement over the next 18 years. So there'll be continuing disbursements of these funds. The majority of that money must be used for opioid abatement activities, and included in the board packet was a informative document regarding approved and recommended uses for that funding, which I hope you all had a chance to review. So these funds are dispersed by the Department of Healthcare Services to the counties. And Lake County received, actually that number has gone up. It's now almost close to $1 million. So we're continuing to receive disbursements. I think it was around $950,000 or something like that is the latest that we've received. And Lake County has established, of course, SafeRx is a longstanding group, but within SafeRx, an advisory subcommittee is established to discuss how these opioid settlement funds will be dispersed. Next slide, please. Okay, so I've excerpted here from that document attached in your board's packet, the top 5 allowable expenditures, high impact abatement areas. So what that means is big bang for your buck. These are really areas where we're going to see investments. And so number 1 on that list is to use these funds as a match for any projects that are proposed through the Behavioral Health Continuum Infrastructure Program. 2 is creating new or expanded SUD treatment infrastructure, addressing, of course, needs of marginalized people within our community, BIPOC individuals, including sheltered and unsheltered individuals who are unfortunately and tragically disproportionately impacted by substance use disorder issues, and diversion of people with substance use disorder issues from the criminal justice system. And there's a variety of ways that you can do that. And last but not least, interventions to prevent addiction from taking place in vulnerable youth. So those are, again, the 5 high impact areas as identified by the state. And it must be noted that at least 50% of the funds must be used towards those activities. So as stated, in 2022, Lake County Behavioral Health Services applied for and was awarded a behavioral health infrastructure planning grant in the amount of $130,000. With that, we have worked in coordination with our Buildings and Grounds Department to secure the services of an architect and engineer firm to give us a new plans for our South Shore Clinic in Clear Lake. The primary purpose of that, of course, is to expand the literal footprint of the clinic to create more space and expand services. It's very hard to expand services if you're at max capacity in your clinics, and we are. We're like busting at the seams. And we know that our services are needed now more than ever. So if we really want to ramp up and meet the needs of the community, we have to have more space. So that project is happening right now. And we expect that we will have, we'll be ready to go out to bid for a contractor in the next 6 months. I would anticipate, hopefully we'll be at that point before the end of the fiscal year. And then we'll really know how much this project is going to cost. But at this time, we're estimating that the project will probably come in between $4 and $6 million, again, for the total expansion and renovation of a beautiful new clinic in Clear Lake for our behavioral health department. And so this grant, the BHCIP has rolling funds of grants, and the last round of that is round 6. And we're hopeful to apply for that, and we'll need 10% of that match, so $400,000 to $600,000. We already have a portion of that saved towards that match, and so we are hoping to earmark or save $200,000 to $400,000 of the opioid settlement funds towards the match for that project. And again, as indicated in the prior slide, that is one of the top priority uses for those funds, and we must spend at least 50% of funds on that activity or one of the other 5 activities that had been indicated on the previous slide. All right, next slide, please. So what are the next steps? If approved, to earmark those opioid settlement funds for the match for that round 6 of the BHCIP, we have about, oh gosh, this is probably like $400,000 to $700,000 left over, depending on how much more we end up getting, to decide as a community what we want to do.
And so we can engage in additional high-impact activities or consider any of these additional approved strategies. So expansion of naloxone availability, increasing the availability of medication-assisted treatment for opioid use disorder, expanding opioid use disorder services to pregnant and postpartum women, expanding treatment for neonatal abstinence syndrome, worm handoffs, a variety of different activities. And I would say that, $500,000 to $700,000 is a lot of money, even in behavioral health that has a, pretty large budget. And so there's a lot that we can do with these funds, but we know that we are in no position to determine what is best. We really, we need that community input to say, hey, here's where we think you would best be served putting your money. So next slide. And at this point, I don't know, Kim, do you want to talk about the SafeRx or anyone else, or I can walk us through this slide?
Yeah, go ahead.
Okay. That's fine. Yeah, so as stated before, Health Services Department has within it the SafeRx committee, which is, of course, a multidisciplinary committee comprised of various community members. And the subcommittee that's being proposed will conduct stakeholder feedback and needs assessments as appropriate to determine where it makes the most sense to spend our dollars. Of course, following the guidance provided by the Department of Healthcare Services. Sustainability of projects will definitely be a central focus. We don't want to prop up programs that don't have sustainability beyond the opioid funding. We definitely want to focus on prevention, support, and I'm sure the board will be pleased to hear really enhanced and robust data collection methodologies to evaluate whether or not what we're doing with the money is making an impact. A focus on evidence-based strategies, of course. And I think that this committee has a long-standing history of looking out for the best interests of Lake County residents struggling with substance use disorder issues. And so I have a lot of confidence that they're going to make really sound decisions if given the opportunity to do so. Next slide. Questions, comments, recommendations?
I have a question for the public to understand, is what do the rest of the disbursements look like?
Moving forward?
Mm-hmm.
We don't know.
We are not sure. I think that it may make sense for us to contact the Department of Healthcare Services to find out if they have a funds distribution schedule. That has never been released to us. So all of the funds were a surprise. And I agree, it would be very nice to know how much funds are anticipated to be received in the future for planning purposes.
Anita?
Your board has been informed of the settlement amounts and the various funds from which they come. There will be more coming, projections of payments. It was a county-approved settlement, as you know, so your board's been approved of all those funds and how the monies are going to be used. Also, as is mentioned, the settlement agreements themselves provide very clear direction as to the use of funds. Just in terms of some of the settlements, and there are additional ones coming in, some of those settlements have not actually, in fact, a recent bankruptcy hadn't involved the county's participation. It was settled by large counties, and the county simply benefits, as all the other counties will benefit in that settlement. Right now, just in terms of the J&D settlements, you've got California Abatement Accounts Fund, the California Subdivision Fund, and the California State Fund. At the state level, they make reference to all of those core strategies, et cetera, just briefly, that are included in the settlement agreement. And they do include, at the state level, high-impact abatement activities, with one provision saying, in addition to the opioid remediation activities outlined within the settlement agreements, California has designated a set of 5 high-impact abatement activities. And it does state that there is no less than 50% of the funds from the Abatement Accounts Fund in each calendar year that has to be used by each participating subdivision. So this is not a simple formula, and the monies are going to be coming in regularly for a period of years, as you know. The actual settlement amounts at this point haven't been identified, though your board has received now year 1 payment and year 2 payment as to certain of the settlements. Another recent settlement resulting in a bankruptcy had I think it was approximately $71,000. So there are going to be some of those coming in as well. I think your board had talked about both short-term and long-term strategies for the use of these monies. Again, within the confines, particularly of the settlement agreement, which you know, the qualifying uses run pages, which are all part of the settlement agreements that are available to the public online as well. And California has also indicated where they find 5 high-impact abatement activities. But again, different funds, different purposes.
Thank you. Supervisor Green?
Yeah, thank you for this presentation. Very exciting to see this money come online. Lots of buckets of money flying through the air. My question involves the cities, in particular the city of Lakeport was a direct litigant, and I believe in this, reached a settlement. At the time I was still on council, we considered the use of those funds. The council as a whole did not feel confident in taking advantage of the opportunity that cities do have to partner with counties in provision of these high-impact activities. I don't believe City of Clear Lake was a direct litigant, but they also are going to receive some benefit payouts from that litigation and probably some of the other litigation that Anita was just talking about. So I just want to highlight that if there has not been outreach to the cities, I think don't need to do it for today's item, but clearly they are affected by this. We have impacts within our cities involving this, and they are getting a little bit of parallel funding in accordance with this. And just based on what I see here, just as I commented back at the time when they chose to kind of hang on to that money, they don't get to use it for whatever they want. They do have to address specific activities in there, and I think it would be well above and beyond either city's capacity to effectively use those monies for the purposes intended. So again, not necessarily pertinent to today's item, but I do hope that moving ahead, that we can both encourage some confidence in our county BH from our city people, and hopefully we can prize some money out of them as part of that confidence so we can actually provide the expanded services that our cities need. And that's just a comment. Thank you.
Supervisor Spatier?
Thank you for bringing this to the board. I struggle to approve Section B at this moment in time for the sense that I'd like to have the big picture conversation. What is the total amount? We know we're going to get 16 more payments, I think it is, that we were told. I want to look at the total amount. I want to leverage that total amount to see how can we turn that into 40 million, how can we turn that into 20 million, how can we make sure that we benefit the most out of that larger amount versus looking at only the 900,000 right now and figuring out what's the best to do with that. I think that is looking at a very small portion of the entire conversation and making a decision without understanding what is the greater impact that we can make. I mean, I love the idea of renovating and expanding the building in Clear Lake, but I want to make sure we're looking at this settlement as a whole. And I don't want to get into details of some thoughts of how I think we can move forward, but I'd love for this conversation to come back with some greater specificity of what it is we anticipate to get as a whole. What it is that if we can get any further information, I know it's unknown what the next payments will be, but we kind of figured out what the total amount is, so we can pretty much make a guess and be close to that. But without that large conversation, I just feel like we're taking a little piece of money away for one project without recognizing what we could be taking away from a much larger, more impactful project. So I don't want to stop the idea. I want to postpone it until we can have that greater conversation with greater specificity as to what exactly are we looking at.
Chair, may I respond? Thank you, and I do appreciate definitely having a big picture context about the totality of the funding and the ways to strategically invest that funding for the greatest good. I'd also like to point out that the BHCAP project is somewhat time sensitive, and it does leverage these funds to grow funds. You're trading in $400,000 to $600,000 for, you know, $4 to $6 million, which is probably for me a once in a career opportunity to leverage funds in order to complete direly needed renovation and expansion of our South Shore Clinic. And so completely appreciate and want to have that discussion, but also want to be mindful of the timeline that we have to apply for these grant funds. The BHC funding project is probably a once in a career opportunity as well for those type of funds to be released to counties. And so I'm mindful of that. That's all.
And what is the deadline?
So they haven't released round 6. They anticipate releasing it in the next couple of months here, which is perfect timing because we have not yet completed the engineering and architecture plans of that, and because we haven't gone out to bid for a contractor, this is an estimate. So it may make sense. I would say in the next 6 months, it's going to get really serious, and we're going to have to put some numbers on paper, and the application's going to get started and things like that. So this doesn't need to be approved today for the sense of timing, and we certainly could bring it back. I just want to make the board aware that there will be a sense of urgency around that in the pretty near future.
And personally, I don't want a conversation in 6 months. I want a conversation in the next 2-3 months to figure out what our plan is so we can finance appropriately based on our plan.
Okay, members from the public.
Does Stephen have a comment?
Oh, Stephen?
He just wanted to say hello.
Are you just here to?
Well, I'm just here in case there was questions about where the funding currently is and if there were any plans during mid-year to put in a reserve, et cetera, until there was a approved plan.
And I just know that with our policies of spending $25,000 without having to come to the board, I would hope that these funds get locked in until we have those conversations to make those decisions, just because I think it's important to look at the whole.
Yeah, well, I appreciate your comment, Supervisor Sabatier, but, you know, I appreciate the information provided today, you know, to help us move forward. I know, looking at the long-term plan, I think, is it over 9 years or 10, or is it that we're going to be getting these payments? I always like being proactive. And as we said, you know, this is kind of the initial step. Hopefully, we'll be using these dollars to continue to bring more funding in. But if there's an opportunity to move forward right now with some other grant funding, with just this allocation being put over, I myself am ready to move forward with this opportunity. Appreciate it if it comes back to then, but we'll just say at this point today, we'll see. We'll see at the end of this discussion. Those are my thoughts.
Supervisor Green?
And just would add, I do appreciate the suggestion for big picture, and again, my request that we kind of loop the cities in. Even if it's hypothetical, I'd like to see what the funding amounts are coming down there, specifically on the Clear Lake side, if they're going to get the biggest benefit from expanding this clinic. Obviously, it's going to be regional in basis, but I think it's hard to do big picture stuff if we don't have all the pictures, and I do think the two cities can and should partner with the county on this, and maybe we just need to ask them nice, and part of what we need to ask them nice is how much money you guys getting. So.
Hey, I'm going to open it up for the public. I don't see anybody in the chambers, and I'm not seeing anybody on Zoom, so I will bring it back to the board. Supervisor Sabatier?
And I'll just add a comment from, based on the comment from Supervisor Green. I agree, we're all in this together. The opioid crisis crosses every boundaries and every line. And I would suggest any stakeholder that has received any kind of settlement funds, which could include also tribal. I don't know if our local tribes were also recipients, but I think that it would behoove us to all meet together and figure out what is the best way to resolve some of these issues, prevent some of these issues, and work on these issues rather than simultaneously working on our own projects. So,
Have there been any collaborative meetings with all the stakeholders and sort of first steps for strategic planning?
Thank you for the question. So SafeRx meets once a month, and from there we were looking to form an advisory committee. But I kind of want to, I really want to open that up, not just to the people who regularly attend the SafeRx Coalition meetings, but anyone that has a burning desire to give their input. And I mean, I'm sure there's pieces that we're missing. And so I would open that up to the community. The meetings themselves, we have met once on a smaller scale, recognizing that we really want to create this advisory committee and move forward with it.
And who would you suggest be on the advisory committee?
Right now, it's members of the SafeRx Coalition, and those are agencies here, represented here, as well as the hospitals and others. And so I would say that if there were others, maybe a board member, a supervisor, could be part of it. I think that there's opportunity there. And I didn't realize that the cities had received funding as well, so that's really kind of cool. And so maybe there's a city member that would like to be in these meetings. I'm open to all of that. We're definitely.
Are there tribal members?
That go to SafeRx meetings, yes.
Oh, okay, great.
But I think that can be expanded too, because I don't know, while I appreciate their participation, whether they're the right member to be on the advisory committee. There might be someone that we're missing that has greater knowledge on a larger scale.
I have a quick question.
Sure.
When you say the SafeRx committee, do you mean the committee that's from Hope Rising?
Yeah, it's now part of public health, but yes, it started with Hope Rising and is now part of public health. And that's the same SafeRx coalition that's been meeting for 7 years.
So the meetings that I've been involved in.
Right, yes, correct.
Just wanted to make sure it was separate.
Yeah.
Any other comments? Well, I appreciate the presentation. I would like to move forward with this and not miss these opportunities. These are pretty amazing. But in collaboration with our other groups and including the cities, but also taking a bigger look at what potentially we could do over the whole 10-year term.
Okay, are we back at the board then?
We are back at the board.
I know, I think we've had two things here opposing, obviously, to bring it back, but I'm prepared to make a motion today and see what happens. So I move to approve portion of opioid settlement funds for use of contribution to BHCIP, match for Lake County Behavioral Health Services, and authorize the Lake County Health Services SafeRx program to establish a subcommittee to make recommendations regarding use of remaining funding.
Second.
A motion and a second. All in favor?
Aye.
Aye. Opposed?
Nay.
Okay, motion passes. Thank you so much. Okay, so that's 7.5.
Did we do something wrong? I see Anita shaking her head.
What?
Anita's shaking her head, so we do something wrong.
What's the matter? No.
Oh. Okay, all right, making sure.
Okay, so we have still some,
6.6.
but it's 10:55.
Oh my gosh, I'm awake.
Okay, so
I am sorry.
7.8, please.
Okay, we'll do 7.8.
Lars is like, please, please, please.
Come on up, Lars. 7.8.
Thankful that missing time.
I thought he just wanted to see the meeting.
Consideration of update on Lake County Recreation Center efforts, public services. Director Ewing.
Right. Good morning, Lars Ewing, Public Services Director. For the board's consideration, this is a brief, intended to be a brief update on the status of what we're calling the Lake County Recreation Center Task Force, for lack of an official term. As the board will recall, as well as Supervisor Green from his time on the City Council, last September, the board received, and as did the City Council, a presentation on a feasibility study of a recreation center and/or a swimming pool located in Lake County. That was at the time, the culmination of a multi-year effort between the county and the two cities. The feasibility study is included as an attachment to the agenda item. There's actually two. There's a phase 1 and a phase 2. Phase 2 essentially is just the final report. At that time in September, the board's direction was to continue participation for a future project development and further investigate the potential of a joint powers authority. The following month, a presentation was given to county and city representatives from consultants who have a lot of expertise in the areas of establishing JPAs, both on the financing side and on the legal side. The consensus from that meeting was to move the concept forward of a potential JPA. Specifically a JPA for a countywide recreation agency, and also to conduct preliminary polling. Also included in those in the attachment are slides from that presentation. That was not presented to the board as a whole, so I wanted to ensure that they were provided here. The Joint Powers Agreement is currently under review by staff at all 3 jurisdictions, and in about a month, we're assuming in about a month, we will be coming to the board for consideration of that Joint Powers Authority. And so we thought it was important to ensure that we come to the board to get a status check and are we headed in the right direction. Also going on right now is a polling strategy, the development of a scientific polling rather than just the general outreach that was done during the feasibility stage. Now, I think we're well aware that the financial needs of this project are not insignificant, both on the capital side and on the operational side, even if the project scope is refined from what was presented in the feasibility study. There are a variety of different potential funding mechanisms. Some examples: direct facility use revenue, jurisdiction contributions, other partnering agency contributions, state and federal requests, grants, donations, and joint use agreements. The JPA, if approved, could form a countywide community facilities district and place a ballot measure for voter approval of a special tax. The question is, would it be a parcel tax? Would it be a sales tax? That's not defined at this point. It's a part of the polling effort that is intended to go forward. It also could be a graduated parcel tax based on a variety of factors: distance from facility, square footage, zoning. There's all sorts of potential ideas. And again, we're not limiting it to simply a parcel tax. The proposed membership of the JPA Board of Directors, as proposed in the Joint Powers Agreement that we are drafting, it does include representation from each of the jurisdictions, as well as a resident at large appointed by the other board members of the JPA. So the next steps, right now, as I mentioned, the polling is in development. The JPA has been drafted. The agreement itself has been drafted, and will come to the board very soon. And then next month, the consideration of that Joint Powers Agreement. So at this point, I didn't have a presentation. Wanted to ensure that you are aware of where your staff is in working with the two cities, and just get any direction from me and also through me to that entire task force. So appreciate any questions and any comments that you might have.
Supervisor Sabatier?
I know that you've brought these numbers, but just kind of curious, do we know what an annual, approximately based on the feasibility study and what we're looking at, what the annual needs would be in order to operate?
Yeah. So depending upon the facility, as a reminder, there were 2 facilities or 2 types of facilities that were envisioned during the feasibility study. One was a pool center, and the other was a recreation center. For the recreation center, based on estimates, the annual net operational subsidy was somewhere in the range of $300,000 to $400,000. For the pool, and again, this is based on on the size of the facilities that were envisioned in the feasibility study. For an indoor pool, bear with me here. It was about $400,000 for an annual net operational subsidy.
And then obviously you're saying net, there's a belief that a certain percentage will be covered just from usage fees, club fees, monthly passes, whatever it is.
Yes, sir.
Okay. And I just want to highlight, I think it was a comment that seemed to echo for the Board of Supervisors. I'll mention it personally. That I want to make sure we're thinking about the people outside of the city areas. They're going to be looking to, if it passes or if it goes to the voters as a property tax or as a sales tax, there needs to be a what do I get out of this type of
Yes.
thought process put into it. And if we're only singling out the cities as the main locations without looking to expand further, I think that we would lose those votes. And so I hope that the conversation continues by remembering Middletown, by remembering the North Shore, and others that are outside of the city areas. Sorry if I didn't state your specific location that is outside of the city areas. But just wanted to highlight that because I think it's really important, because those votes are going to make or break whatever is proposed.
Yep. And that's, I appreciate you bringing that up. That has been a point of emphasis all along, and a concern with just these two facilities. Obviously, these are the ones that we did the feasibility study for, but consideration of the more remote locations, at least. I mean, unincorporated means not very far from here, right? I mean, we're really just outside of the city limits is unincorporated, but what we're really talking about are say North Shore, South County, making sure these areas that if we had facilities in each of the two incorporated cities, how are we providing recreation facilities that would justify a community facilities district for citizens who don't have direct access to that. There are a variety of options with that. It could mean facilities that are in those areas, improving existing facilities, but also coordination with transportation. We talk about Lake Transit Authority. I've had conversations about that. So there's no answer. I don't have an answer to say, oh, here's what we're proposing in the North Shore, or here's what we're proposing in Middletown. But the way that the JPA is drafted, it's not limited to just these two facilities. It allows recreation facilities that would serve the community at large.
Thank you.
And I just have a comment about a measure for a tax. Depending on what district you live in, you're already heavily levied in different areas. And I mean, I would say for maybe the sales tax would be a more successful route, and that way all the residents are contributing, because in certain districts, there are quite a few assessments that are already on the rolls.
Sure.
And that will affect how people make that decision.
Yeah, and by no means is the parcel tax the one we're looking at. Sales tax is still on the table with the concerns that you mentioned. The polling that we're developing, that's why we're doing the polling. Is this viable? Or do we have any interest in this by the public to pursue this? The establishment of a JPA, as I understand it, is rather administrative in nature. But to move forward with a community facilities district would really be the meat to get the funding behind it, and that would require that's going to require some additional funding above and beyond what we have. So the polling is really going to help drive that. It will include questions that will help inform us about parcel tax, sales tax, other opportunities. So it's informative.
Supervisor Green?
Yeah, thank you. I know this update, just no action today, but as it was when it was presented over the city, it's a big lift. It's good to dream big, but all the financial analysis done so far indicates it's going to cost us big to dream that big. And although this is focused on the creation of the JPA and these needs that are kind of unmet in our community. I just want to compare and contrast again, just because I'm educating myself on the existing collateral the county has in its portfolio for park facilities and stuff like that. So before I go too far down JPA landia to get into this new vision for these facilities and not to discount the need for them and the community's interest in them, I just want to catch up a little bit to where the county is currently with its financing and operation of its current recreational facilities.
Sure. Well, I'd be happy to come back at the next board meeting with a presentation on that, where we are with county facilities. I mean, we have but the mid-year budget, would be an opportunity to discuss that. I don't have it at my disposal right here, the exact numbers, but I do know relatively well my own budget, certainly. And so we do have a Parks and Recreation budget that funds on a recurring basis, essentially the maintenance of our approximately 24 parks. I say approximately because what one person might call a park, another person might call a boat launch. So it's approximately. But we do have funding to maintain those facilities. The improvement of those facilities or any other proposed facilities is typically handled on a one-time funding basis. That's the best way that we can put it. There was discussion a few months ago, I believe, or possibly at budget adoption, discussion of a recurring reserve for improvements, basically a capital budget for improvement projects. So we don't have that, but we do have, above and beyond the one-time funding, we have grant funding that we're working, that we have for park improvements, but on an ongoing basis, funding for maintenance and I'll say some nominal improvements at each park or at some parks.
And when is the master plan going to be coming back
Sure.
to us?
You'll be coming. In fact, we intended to have it this month. There were some delays at the consultant side, but likely it could be at the end of this month or early March, coming to the board with an update. We are at what we're calling the engagement window 2. There will be a public survey. Actually, we just posted on social media the beginning of that yesterday for a survey to get public input on what are the needs that we have. But yeah, that will be coming here very soon for the status of the master plan effort for parks, recreation, and trails.
Okay.
Have to add those, the
Yes.
full 3.
Yeah, so if you want to meet with him offline and talk more about the budget, because we already have that presentation coming up, so it should be adequate. Supervisor Sabatier?
And I just want to jump off of something Director Lars mentioned about the capital improvements. Did offer and didn't happen to put in $1 million. We had a lot of rollover from the previous year. I think we do need to look at growing some sort of foundation for this. As Supervisor Green mentioned, the overall number is a very large number. We're not going to get all that money for free. We're probably going to have to do some sort of match, and that match is probably not going to be a small amount that they're going to be requesting. And so I think if we can slowly increase some sort of reserve for these projects to make sure they happen. I know that the City of Clear Lake is already doing that. I'm certain the City of Lakeport is looking at that, and I think we as an equal partner in a potential JPA in the future, we need to come into play with something rather than saying, we're here.
Right.
So I hope that we continue those conversations.
Okay, and I'm glad to hear that. I want to make sure, at least for the administrative side of things, that when I use the term reserve, I may not be using the right, I'm not speaking about it in a financial way because that means something specific, but essentially I think a capital
savings
reserve
account
is the best way to say it. So, yeah.
Okay.
Oh, yeah.
Oh, there you are.
Yeah, so Supervisor Sabatier mentioned the North Shore, so I wanted to, I know you and I have talked about potential areas or something along those lines, possibly transportation. I think just from history, I know in a situation with the previous initiative, voting on a tax either way, I know that having an earmark is very important, whatever it may be, and I don't know where that comes from, if it comes from us or the JPA recommends it, but it is an important factor. So I think that might help with the survey, right? You're still conducting that. So, so yeah, I just wanted to highlight that because I know after a different initiative failed, the community was like, there was nothing in it for us, so it's very important to have that.
Great.
So.
And I'll carry that, and that won't come as new information to the group, but I'll carry that back and emphasize that. What we don't have at our fingertips is something to the level of what's in the feasibility study for those other proposed or ideated facilities. I know that's not a real word, but we don't have anything for a facility on the North Shore or proposed improvements to to the Middletown pool. We don't have those available, but I think we need to start. So I'll take that that's the whole point of the direction to staff. Take that as marching orders.
Right. So as long as they know that when and if the vote comes, they know that there's something set. So that
great.
Yeah.
Thank you.
Okay, so, oh, sorry, go ahead.
So if you can clarify for me, the only kind of opportunity we have to even do a comparison of what potentially this could be would be the Middletown pool, right? Is that the only pool that the county owns where the tickets are sold? It's got the pool, it's got the tennis court, and I think the playground, is that part of county-owned property there too? Because it's right all up to the school. So that's the only operated facility that we have. So I would just suggest maybe having that, if you're going to have an offline conversation, that's kind of the only thing that you can really compare it to that we're doing from the county side.
Well, and if I could offer that's what was envisioned in the feasibility study. I've stepped back from calling it an aquatic center because I think people might think we're building Marine World. We're not. We're talking about a pool here. Now, the pool in Middletown is a kind of a community pool. It's a relatively recreational pool. What was envisioned initially in this through the feasibility study was more of a competitive level pool to get, and there's a certain size, there are certain size requirements for that for competition level swimming. There's also been discussion of other opportunities for competition there, but it was on a larger scale. It was more of a regional basis. It includes a lot of indoor facilities there, maybe a room for parties. I'd be happy to come back, and actually it is included in the attachment, some of the feasibility studies that show the concept of that facility, but it is at a much larger scale than what is.
Yeah.
That doesn't mean that I'm sorry but it doesn't mean that couldn't be revisited to ensure that the scope matches the need.
No, I'm not talking about scope. I know it's going to cost to run the facility. So I think for just a reality opportunity is to look at, all right, what does the Middletown pool do? Because they do sell, right? Tickets are
Correct.
sold.
Yes, yes.
And uses happen. It does have the ability to be rented. I don't think it happens a lot, but I know we personally rented the pool. You have to get the insurance. You have to pay for the hours. You have to pay for the lifeguard. You can do those types of things for private parties there. So, just if you're going to really look at it and say, all right, well, what could this aquatic center be? What would it cost? Looking at that, I think, is the only income-based pool that we have in the county that we operate. So all I'm saying is if you're looking at things budget-wise, that, yeah, it's a very small snapshot. It's nothing like what you're going to build, but you can look at that and say, all right, what's the reality of that? And I know we're talking about the tax measure, but I've been on this board, and we had an unsuccessful tax measure which was just kind of evening out the taxes from the cities to the county, the unincorporated areas that did not pass. So anyway, just looking at those long-term opportunities. So I'll just throwing it out there as a suggestion of, it's nothing like what we're going to build, but here's the reality of what's happening right now with that pool. And it does operate. A lot of kids, I know I've been to it. I think most of the board members, I know at least 3 have been there. I've heard comments. I don't know if the rest have been there during the summer, but it's used. But what is that opportunity from a profit level to keep it going? So,
I appreciate that clarity. And
so that's all was my comment.
Supervisor Green?
I think everyone would be thankful I have not yet been splashing around in the pool. I'm thinking that. So to the vision of this recreation study, so you're right, aquatic center sounds big, and it is big. And without speaking for the various people that have been pushing so hard for it, I don't want to say, oh, that's never going to happen. I want to acknowledge the vision, the largest part of the vision that is in that feasibility study. And if you haven't had a chance to go through all 163 slides, it's interesting. And it's kind of modular. So the biggest part of the ask would be basically one, aquatic center that would be sufficient to really do some exciting things for the county as a whole. Maybe that is too much and we would have to split that in half. And so how do we serve the sides of the county with smaller facilities? And then we kind of keep devolving down to, well, Middletown has a pool, well, Lakeport hasn't had a pool for at least 10, 20 years or whatever it takes. So there's a definite need in Lakeport, definite need in Clear Lake and what have you, definite need in the North Shore. So there's any number of ways you can slice and dice this. But the genesis of this latest recreation study is focused on an aquatic center, is focused on that bigger vision. And I do think it's a heavy lift, but I don't know that I can immediately say, oh, we just got to slice it down to a community pool for each district and we'll do a JPA on that. I don't know that that wins with the voters any more than the broader vision for an aquatic center does. So, I just want to be respectful to the ideas and the people that brought us this far. I want to keep calling it aquatic center just because that seems to be the focus of this recreation study, more so than other types of recreational amenities. So, yeah, when it comes back, I want to make sure we stay realistic in terms of what we do with our community pools if it ends up going in that direction. But I also want to be honest and true to the vision that brought us here, true to the vision that the people who brought us this far have and acknowledge that. I still think it's a heavy lift. I think 5 community pools will be a heavy lift too. So we'll see where that discussion goes. But I just don't want to throw in the towel on the aquatic center concept just because I do think it is the biggest of the asks and probably the most expensive of the asks. I think the JPA is kind of ministerial and we can kind of see where the discussion goes. But just trying to highlight a little bit of the history of this recreation thing as I understand it. I may be explaining it badly, but it's both. We need recreational facilities around the lake that people can get behind in terms of a sales tax measure or other type of revenues, but we also need kind of big attractions that this county just doesn't have an opportunity for, and that students and community members in larger cities really do enjoy quite a bit. And so the aquatic center, I think, is a proper name for that. So let's just see where the discussion takes us.
Supervisor Sabatier.
I just want to clarify, I don't think anybody demoted the aquatic center.
Nope.
I think we've already had those conversations, and we've agreed to look for a competitive style aquatic center to provide a place for swimming meets to occur in Lake County. But the idea is, if we're going to be doing anything that requires voters to approve something, to look at ways to also, not in place of, but to also ensure to provide to others so that we can get those votes, because if we don't provide to others, it's going to be a hard lift, and at that point, it probably would not pass, is my belief. And so that's why we've been kind of harping on, let's make sure not to forget the other more remote locations. It's not to replace, it's in addition to, which does add a burden, but at the same time, we can't forget the people that don't have access to those areas that we're originally speaking of.
Okay, I will open it up for the public. I don't see anybody in the chambers or, oh, we do have one hand up. Mr. Pettis. If you can state your name, you have 3 minutes.
Hi, I'm Mr. Pettis, and I run a group of All Children's Thrive at Clear Lake High School and within Lakeport. I know that a few of you are familiar with that group. I do have a group of students who are very interested in the construction of either a recreational center or an aquatic center, and they would love to give public comment on this topic in the future, as well as give their input into the design. So I'm absolutely going to be informing them of the survey that Mr. Ewing already did, but I would like to make a request that the meeting set up for the end of February or March be timed so that I can allow my students, pull them out of class, and give them an opportunity to speak to you guys directly if no one would be opposed to that in the future.
Definitely not opposed.
Right. If I could respond.
But that was for the Parks Task Force?
Well, it could be for
Yeah.
both, to be honest, but, and actually, it would be appropriate to have it timed, in my opinion, for the the master plan effort countywide, but also for the formation of the JPA is when that would be coming back. So from a staff perspective, there's no reason not to time either one. And I wanted to just clarify on the survey, it is forthcoming. There's two moving parts. The Parks, Recs, and Trails Master Plan, there is a survey going out now. That's already out. But specific to the item that we're discussing, there is a polling effort that is in development, and that will be going on, but that's not a put out to the public at large and respond to whoever wants. No, that's a polling effort that is quite a bit different than surveys. So I apologize if I confused anyone with the discussion of both of those.
Great, thank you. Okay, I'll bring it back to the board. Supervisor Spatier?
And just real quick, I'll share Mr. Pettis's contact information with you. That way he and his students can have access to the material.
Great.
And make sure that they have time to look at it and review for their comments.
Wonderful, thank you.
Supervisor Green?
And yeah, to the last speaker, we'll love to see the students here at the board. They love to see them at the city council. I know this for a fact. And you don't have to pull them out of class to do that. That's an evening meeting. And same thing for the school board, who I think would probably be on the hook for any JPA agreement that we move forward. So love to see the advocacy. Want to make sure we spread the wealth to our city and school partners. Thank you.
Okay, well, thank you, Lars.
All right,
Appreciate
thank you
the
very much.
presentation. So we've got time, should we do 7.9 or should we do the consent?
No, Patrick is waiting. He's in the Zoom.
Okay, 7.9, consideration of agreement between the County of Lake and the California State Franchise Tax Board and authorize the treasurer tax collector to sign.
Good morning, Board. Thank you for allowing me to make this presentation this morning. The agreement before you is with the Franchise Tax Board Court Ordered Debt Division. This is a long-standing agreement that we've had as a county. It's one of the primary enforcement tools for court-ordered debt and court collections throughout the state. And this is just a renewal of the existing agreement. It did come to my attention earlier that one of the PDFs, because of a encryption upgrade the state did, may not have been visible to folks on Granicus. So while the agreement, it should be visible to all of you, the signature page may not have been readable depending on your Acrobat version. So I can go ahead and share that if it would please the chair.
Yes, please.
This is the agreement that's created by the state. It's a template. It's used with all their different departments. So it's just indicating that we're going to engage in the same renewal as before. And the text of the agreement was already posted for your board to consider. And I'll scroll down just to show. That's it.
Okay, thank you.
If there's any questions, I'm happy to take them.
Questions? Supervisor Spatier?
Just a quick clarification question. There's over $700,000 in excess proceeds in this, approximately $400,000 that are being requested by individuals or entities, and the rest is going into general funds. Is that correct?
I'm not sure what you're referring to, Supervisor Sabatier.
So sorry. That was a different item that you had. I apologize.
You're referring to the excess proceeds item from the, okay.
Sorry. Ignore me.
Question about this item?
No, no. This is formal. It's very awkward. You got me back.
Okay, I will open it up for the public. I see none. And bring it back to the board.
There's no additional comment. Madam Chair, I move to approve the agreement between the County of Lake and the California State Franchise Tax Board and authorize the treasurer tax collector to sign.
Second.
Motion and a second. All in favor?
Aye.
Item, or opposed? No. Item passes.
Thank you.
Thank you, Patrick. Okay, So should we go to,
Chair, we have Director Portney on Zoom to answer 5.14.
Okay.
That was pulled.
Yes.
And that one's real simple.
All right, we will go to item 5.14. Director Portney? Approve oh, no, that's not the right one. Approve contract between Lake County Health Services and Trina Maia for physical therapy services in support of the California Children's Services Program, CCS, and the Medical Therapy Unit, MTU, for an amount not to exceed $10,000 and authorize the chair to sign.
I think Supervisor Sabatier, did you pull this?
Yeah. Do you want me to? So the only reason I pulled this is on the fourth page of the PDF, which is, I believe, the third page of Exhibit A, or second page of Exhibit A. It says county responsibilities, and the term in 3.2 is different than the term of the agreement. And since we have a contract with Trina Maia prior to this, I want to make sure that we separate all the dates and everything fits in their compartments. So I'd like to change 3.2's term to be January 1st, 2023 through June 30th, 2023 in order to match the front page term, which is exactly as I just stated. And that's the only change I would like to make.
Director Portney? We're not able to hear you.
All right.
There
Good
we go.
morning, board, and hello, community. I agree with Supervisor Bruno Sabatier about modifying the dates to reflect an updated MOU accordingly for service provision for CCS.
Okay. Any other comments from the public? Okay, I'll bring it back to the board for action.
Madam Chair, I move to approve the contract between Lake County Health Services and Trina Maia for physical therapy services in support of the California Children's Services Program and the Medical Therapy Unit for an amount not to exceed $10,000 and authorize the chair to sign with amendment.
Second.
Motion and a second. All in favor?
Aye.
Opposed? Motion passes.
Do you want to do calendars?
Yes. I feel like we haven't done calendars in a very long time. Okay, so we'll start with Supervisor Green. Go down the row.
I'm here today. Let me see. Looks like APC LTA tomorrow. Mental Health Advisory Board on Thursday. Friday, I'll be doing a little sit down with our cannabis program manager. Looks like on the 16th, we'll have Continuum of Care. There is a mixer out at Mendocino College on Thursday the 16th, where they're going to celebrate the installation of the new illuminated sign. So that's kind of cool, and I'll get a little lunch and a little tour after that, so I'm excited to see that. Just real quickly, the week of the 20th, I will be at my second installation of new supervisor training down in Sacramento from the 22nd through the 24th. So I will be out of county on those days. And that's about all I got right now. Thank you.
Supervisor Simon?
LTA and APC meeting tomorrow with Supervisor Sabatier. So we'll be doing that in the morning. I think, too, I've been notified that there will be a meeting tomorrow at 1:30 at the Big Valley Rancheria with some folks from the Water Resources Board coming in. I was just informed that. I got an email this morning from Sarah Ryan, and also spoke with Commissioner Dee. I think she is the vice chair. So a lot of tension, obviously, moving in that direction. So hopefully we'll have some good discussions. Did you get an invite or anything for that tomorrow? No, I'll find out. 1:30, Big Valley. So it's at Big Valley. It's on the second floor in the conference center. It looks like I'll send that along, but if you could attend, that would be That would be great, Michael. And so Thursday, have the Middletown Area Town Hall Thursday. And then Friday the 10th in the morning, have the meeting with CAO Parker. And we have the weekend, the RRA meeting. What is the
20th.
The 20th, yeah.
No, it's not. It's the 27th.
Oh, yeah, we moved it because of the holiday. Okay. I was thinking we moved it backwards. My apologies. So the, and we have board meeting here on Tuesday. For some reason, it's not populating on my iPad. Could I get that figured? I got it on my phone, but our board meetings aren't popping up here for some reason. Maybe I did something. I'm not blaming anybody. It could be me who did something, that it's not on my iPad, so greatly appreciate it. And so back here on the meeting on Tuesday. Tuesday night, too, I'll just talk about Tuesday night, have the Lower Lake Action Committee group has started up again. We had our first meeting. I did the kind of state of the county with them last month. Glad to have that board back. The Lower Lake Action Committee group is, you know, obviously it's not an advisory committee. They're off on their own. Sometimes I really enjoy that, that they just kind of do their business, make sure to attend. But they have moved their meetings to Tuesdays because it had conflicted with the Canocti School Board meetings, and now it's Tuesday nights. So my request would be, let's get those agendas done by 5 so I can attend that meeting at 7. But I did make it last month, even during the rain, and it was great to just have that community meeting back up and running. And a few little projects we have going on there, hopefully to help the cemetery on some tree issues that they have inside the cemetery of Lower Lake, which are really important. So, all right, that's it.
Supervisor Spatier?
So let's start with what's going on tomorrow. I already know about the LTA APC meeting that we'll have. I'm going to listen in to the Sulphur Bank Superfund site conversation. Already listened into one, I believe, last week. Just want to keep listening in case there's new information that comes through. If I have the chance, I'll be joining the Canocti Unified School District Board meeting that evening. On the following day, on Thursday, I'll start my day off with Judge's Breakfast. Again, that's happening over at our Senior Center. Starts at 7 a.m. Please come out there if you want to learn about what's happening in your community. And then I'm going to Woodland Community College. The library system is starting the big read, and got contacted from Georgina Guardado, who is our poet laureate, and she is putting this together, working with our library system. And the big read this year is Post-Colonial Love Poems by Natalie Diaz. And there's going to be an event happening on Thursday at 12 to 2 p.m. And I will be sharing some words there as well. So check out the book. It's one that a lot of different people will be talking about and reading, and interesting stuff. Then Clean Water Management Council meeting, I will be attending that as well. And that's it for Thursday so far. And then on Friday, I've set it up on my calendar, as I had stated, both to the Continuum of Care, and I believe I also made the statement here for the Board of Supervisors. I'll be visiting every Friday to check out how the warming shelter is doing over at Juvenile Hall. Right now, I have some questions just to see how things have been set up. They did a soft opening. I believe that their main opening will be happening, I want to say, within the week. But they have done a soft opening, and appreciate the fact that the building was available and ready for them to utilize, and thankful for the board's approval as well to move that forward. But just want to go visit and see how things are going there. And following week so far is pretty clear, just a CAO meeting and then Board of Supervisors on the 14th.
Supervisor Crandall?
So tomorrow morning early, I fly out to DC with RCRC. We'll be making hill visits from the 8th to the 10th, and then on the weekend there'll be a NACO conference. Pretty sure there'll be some other scheduled visits as well, though, so we'll see how that goes. I'll probably miss majority of tomorrow's, but I'm scheduled for the 9th and 10th. which will be, going and visiting specific Congress and Senate, and also superintendents or directors of specific, entities like EPA and things like that. So I've got a packet that I've been reading through that we'll be bringing forward to talk about with them, fire, things like that. So then I just need coverage. I know Supervisor Sabatier said he'll cover the Clean Water Management Council for Thursday. And I think Supervisor Green, you're on the visioning forum with me, right, for it's the Monday night, we have the Community Visioning Forum Planning Committee.
Sure.
Okay. I think he's on there with me, so, yeah. And so I won't be, I will be in the air, so if I can get on, I will, but I doubt it.
It's going to be rough.
But I'll be back here for Tuesday's meeting, so.
Thank you for going.
Yeah, I'm glad that, they asked me to go. The reason why I get to go is Dan Miller, who was the president, retired and went to Arkansas, so they had an open spot because we've been on for, I'm probably one of, many people retired, so they were like, well, you want to go? And I was like, well, you guys paying for it? Yes, so, yeah, as long as they're paying for it, I'll go, but I'm not going to, go otherwise, so.
Okay. Well, thank you.
Right.
I went to the Wrangler Roundup dinner at the fair Saturday night and raised a bunch of money for the Fair Foundation. They have been able to complete some of the projects, but there's just a lot of deferred maintenance over at the fairground. So any way that we can support them, it's important. And so it was really fun Saturday night. And then tomorrow, I have a gender review, I have a meeting at hospice, and I have a meeting with the strategic planner that's been engaged by clerk, then a meeting with staff on CAL FIRE grants. 100 Women Strong is in the evening, but I'm just not sure I'm going to be able to make it with all of those things that day. Thursday is the Fire Safe Council. And then every Thursday at 2, I have my breakout group for my leadership class. And Friday is my birthday, and I'm not working.
Happy birthday.
And it looks like this weekend is mostly clear, too. So Monday, I will have my meeting with CAO Parker. I have a meeting with the RCC Round 1 application debrief from our Climate Safe Lake application, and then getting ready for Tuesday's meeting. And we have 6 minutes until our next item.
I forgot. I'll just add a couple things because I said fire. I want to be more specific on the things that we're talking about so that you know. Payment in lieu of taxes is one of the discussions that we'll be having. Farm bill, cannabis banking, let's see, BIL, IRA, and I think that's the Inflation Reduction Act, so we'll be having specific asks on that. We'll be meeting with Doug LaMalfa, Michaela Body from the Senator's Office for Senate Agricultural Committee. Let's see, policy advisors for Alex Padilla. He may join Chief Randy Moore for the U.S. Forest Service, and I think that's something that I'll make sure that I can get to somebody for that. Zoe Lofgren from, she's a congresswoman. Eric Hoffman for Mike Thompson, but I think that's tomorrow, so I won't be able to make that. But I mean, we see him all the time, right? Kevin McCarthy, let's see, and Ron Snyder from the advisor for agricultural to the administrator, EPA. And I think Friday we see Senator Feinstein. So, yeah.
And then I had just sent Supervisor Crandall the email that Supervisor Sabatier and I received about delaying the prescribed burn that was supposed to be happening this year in the Black Forest that has been planned for many years because of PG&E cutting trees and leaving them in a sensitive area. So our CRC has been advised on the problem, and when I reached out to BLM again yesterday, they said it likely won't happen this year, but that we need to talk to his manager, and so anything that we can, any wheels we can get moving to deal with this so that we can get that project done. It's been way too long, so I really appreciate you carrying that for me.
I'm also taking some stuff for Middle Creek Restoration. They've given me like a paper to pass out, and if I could sneak over to, I think it's the Department of Interior, because I know we've had that situation with the Army Corps, one of the tribes doing a feed a trust application, so trying to get them to understand what's going on with that. I know that there was discussion between one of the representatives from Army Corps, but it always helps to be there in person and hand that information to them so they understand the realm of it, so. Yeah.
Well, and he's out of the room right now, but I know Supervisor Spatier is having difficulty with prescribed burning in the monument area, and so some help with that would probably be great too.
Okay.
Okay, we have 3 minutes now.
I missed one meeting on my calendar.
Okay.
It's class and comp. I think it's from 3 to 5 tomorrow afternoon. I think that is the time is for. Actually, 3:30 to 5. So 3:30 to 5 tomorrow. I missed that one on my calendar. That's not 3 minutes, but hopefully that helped.
Okay. Yeah, I just brought it up. We were giving him a list of things to talk to people about in Washington, and so the prescribed burning in the monument. Yeah? Okay.
If I'm on class and comp, do I get an invite? Or, thank you.
I'll double check.
And just for being more specific, it's mostly, it seems to be a wilderness issue, but the monument might also be a limbo. So I think looking into both is good.
But it's national lands or federal lands?
It's federal.
Okay, yeah, that's what I thought. Okay, now we're down to 2 minutes. Um, 5.2 later, that would be the only thing. We've hit them all, right? 1, 2, 3, 4,
2-minute break.
5,
2-minute break.
I 6.
I think Michael needs a break.
All right, we'll take a 2-minute break. Come back at 11:45, please. Okay, we are back for item 6.6, Lake County Health Services Tobacco Education and Prevention Program Update. Health Services, come on up.
I electronically sent it to you.
And Madam Chair, if you don't mind, I do have a hand up from Mr. Pettis. Mr. Pettis, I've asked that we go ahead and start with the presentation, and at 12:15 at the latest, if the presentation is still going, that we can pause for your students. Hopefully that works for you. If it does, go ahead and put your hand down, and they'll tell me that that works for you. If it doesn't, then I will need to figure out something else. And his hand went down, so I think we're good.
Okay.
Thank you.
All right, thank you for being here and being patient.
No problem. Okay, so I want to first off say good morning, or close to afternoon, and thank you for the interest in continuing the discussion related to the leading preventable cause of death and disease in California, which is tobacco. My name is Liberty Francis, and I am the project director for Lake County Public Health Tobacco Education and Prevention Program. Today we would like to discuss a few things. One, review adult tobacco use rates and vaping rates in Lake County versus California. Bring back the draft policy that was worked on prior to the COVID pandemic with the board at the present time. As well as options to create a comprehensive policy to protect the community's health. Third, we're going to continue a discussion about smoke-free outdoor places and what surrounding cities and county jurisdictions have done to protect the non-smoker. And fourth, provide information related to the smoke-free multi-unit housing projects. Today in the room, we have Greg Dameron from Blue Zones, Joanne Sacato from NorCal for Health, and then in our Zoom room, we have a couple partners as well. Diane Kaiser, PhD, and she is from Health and Social Policy Network, Communities Against Nicotine. And Jay McCovery, PhD, and he is with Tobacco Free North Coast. So to share a little bit about tobacco use rates in Lake County, they have been much higher than the state averages for several years. The average percentage of adult smokers in California comes in around 11%, where Lake County has been hovering in the 20s for the last several years. Clear Lake and the jurisdiction of Lucerne being the highest, around 25% of adult smokers. This is according to the California Health Interview Survey. When we look at the youth surveys, they are self-reported, and that's the Healthy Kids Survey. They're looking at about 35%. Now, the thing about this survey is it's done at school, and they may or may not report all of the things correctly due to fear of getting in trouble. What we've learned working with youth in our tobacco youth coalitions is these averages are much higher. When we asked a group of students recently at Upper Lake High School, what percentage of your peers do you think are vaping? They unanimously said between 80 and 90%. One student actually said 100% until she realized, oh wait, I don't vape. So she lowered it to 95. This is not only an issue in the high school levels. Recently, I have been addressed by school administrators in the elementary level as young as 3rd grade that are being caught using these products on campus. The staff, the families, and the community need our support. It's no surprise that smoking causes cancer, heart disease, and other health issues. The Health Ranking Roadmap identifies Lake County as having one of the lowest ratings for health in the state of California. We currently sit at 56 out of 58. Our community members need our help as well. Unfortunately, there is a common misconception that the chemicals hiding behind all of these fruity flavored vapes and e-cigarettes are somehow healthier. A 4th grade student told me at the end of last year, it's like it's something good to eat, like a sucker. This is the same student that shared with me it's easy to get his vapes. He just goes to the guy outside the gas station over there and gives him money and tells him keep the change. This is a 4th grader who's already identified how to work the system to get his addiction taken care of. In Lake County, approximately 30% of 7th graders, 60% of 9th graders, and 70% of 11th graders reported in the Healthy Kids survey that it was fairly or very easy to access vapes in Lake County. I'm going to tell you a little bit about what a tobacco retail license is and how that's identified in our county as to something that could help with our youth use rate. It's a it's a cost-effective way to reduce the availability of an addictive and deadly tobacco product. The policy provides resources for local enforcement and are proven to reduce illegal sales to youth. For instance, in Sonoma County, prior to their tobacco retail license, they had a youth purchase rate of about 18%. They were able to reduce that rate to 1.3% in the years following implementation. With a tobacco retail license, a jurisdiction monitors local tobacco sales by requiring retailers to purchase a local license to sell tobacco products. This local license fee covers the cost of TRL development, enforcement, and administration. Licensing enforcement is how this policy helps address issues like youth tobacco or nicotine use. By regular store inspections and compliance checks to ensure retailers are not selling to minors. The consequence of fines or revoking the right to sell these products in their stores serves as a deterrent and to make sure that their employees are following the State Act guidelines. So I'd like to introduce again Greg Dameron from Blue Zones, and he's going to share a little bit about the recent SB 793 flavor ban for California.
Thank you, Liberty. And those are grim statistics. I always get depressed a little bit hearing those. But the good news is tobacco retail license ordinances are evidence-based to lower teen initiation rates. And I have some good news to share with you today. And you may know some of it, but rarely do we have a statewide opportunity to take the pulse of state support for tobacco prevention as well as local, but we had in this past November, SB 793 went to Prop 31, and in Lake County, as we heard, we have high smoking rates and teen use rates. We had 58% in support of one of the most widespread and drastic interventions of tobacco products to 42 opposed. So what does that tell us? I'm not a voting stats analyst, but what it tells me is that we're probably aware that we have this challenge here, and we have support in our community, vast support, a movement of wanting to address this. By comparison, Yuba County, close to the same number of voters, 47 in favor of of Prop 31, but 53 against, so it's the reverse. So I look at that in terms of taking the pulse as amazing. Local control is key. State is not going to do much to help support that. So when we look at TRLs as the acronym, and as Liberty has mentioned, local control is key. And we have a pulse in terms of community support for this here. It's a rare opportunity that the timing of this is coming in a good way. So that's just what I wanted to share in terms of context with that.
Great, thanks. So next I'll just share a little bit about how a tobacco retail license can also provide opportunities to address the burden of tobacco products on the environment, by reducing or restricting the sale of products that are identified as hazardous substances. As outlined in the document that I provided to you, the burden of tobacco on the environment, vape waste is particularly hazardous to the environment because it creates plastic waste through the devices, the cartridges, or the pods, toxic biohazard waste in the nicotine and the chemicals included in those products, and the electronic waste with the batteries. Currently, the manufacturers have no guidance on how to safely dispose of these products. When these products are littered, flushed, or thrown in the trash, they can leak toxic heavy metals and chemicals into our soil and water systems, posing a danger to wildlife and humans. Next, a healthy retail environment is one that denormalizes tobacco use. Joanne Sakato with NorCal for Health will now share with you ways that tobacco product placement and store advertising play a role in youth tobacco use.
Thank you, Liberty. And thank you, Madam Chair and Supervisors. It's an honor to be able to be here and bring to you some information that our project has learned about around tobacco advertising and how big tobacco and vape companies are targeting our children, particularly in rural areas. And I come to you today not only as the Community Engagement Coordinator for the California Health Collaborative's NorCal for Health project, but as a Lake County born and raised woman who started smoking tobacco, commercial tobacco, at the age of around 12 and struggled with that addiction for more than 25 years to be able to finally quit. And I have to say that when I started this project a couple years ago, I had been out of the tobacco retail environment for 20 plus years. It's been that long since I quit. And I have to say I was aghast to learn what has happened in the evolution of not only the products, but how the products are being marketed and targeted towards younger and younger audiences. I could not believe that I was seeing cartoons and flavors for a product that you need to be 21 to use. So I want to share 4 points with you, and it's from a flyer that we included in your packet about product placement and advertising. The first is that I'm not alone. As Liberty shared with that data, there are a lot of youth that are starting these dangerous and addictive products. In fact, 90% of today's tobacco smokers started before the age of 18. So that's one thing, but here's what I find kind of concerning. It's what tobacco companies know. Do we need to do anything about that? Okay.
They're on it.
It's what tobacco companies know about marketing to youth. So they know that youth are 3 times more sensitive to tobacco marketing than adults are. They also know that if youth are exposed to tobacco marketing, they are more than double likely to start using the products. So tobacco companies know that kids who see it, try it. So what they may not know, and what we know, is that when you put tobacco product restrictions in place, youth engagement, youth initiation, and youth use go down. So what does that look like?
Well, for storefronts, if we're looking at the exterior of our stores, one strategy that's being used is to reduce the percentage of windows that are covered by advertising. So the model is about 10% coverage. And that reduces the normalization that these products are part of our community, and it reduces the exposure and impact to anybody walking by, but particularly to our sensitive youth. It also has the added benefit of reducing crime and increasing public safety and reducing blight in our communities. When we look at the interior of a store, what's happening is these products are really difficult to distinguish from kid-friendly products like candy and snacks and sodas. And so communities now are adopting policies that actually create a minimum distance requirement between these nicotine and commercial tobacco products and those kid-friendly products. For instance, Del Norte County just recently passed in their tobacco retail license a 5-foot minimum, so that the tobacco products could not be placed within 5 feet of any kid-friendly products. And a few years back, the city of San Diego did the similar thing with a 2-foot distance. So all of that to say, our youth are sensitive. Marketing matters, and it's intentional to try to hook the next generation of customers by our vaping companies and the big tobacco. Our project is here that if the board decides to move on the tobacco retail license, and particularly these aspects of that, we're here to offer technical assistance, language, after policy adoption support. And so again, I thank you for this opportunity to share this information with you, and I return it back to Liberty.
Thanks, Joanne. That's been great. So our next topic is smoke-free places, outdoor places. And I've provided support documents in your packet. One of them is the Lake County Jail policy that you currently have. And then also the Health Services Department had went 100% tobacco and smoke-free. And those are also included in your packet. And the City of Clear Lake's 2019 comprehensive policy on smoking in public places. I'm going to turn over to Jay McCovery in the Zoom room. And Jay's going to speak a little bit about smoke-free outdoor places in other communities.
Okay, I hope everyone can hear me.
Yep.
Thank you for the opportunity to be here and zoom down from Arcata. My name is Jay McCovery, and I'm project director of Tobacco Free North Coast. I've been doing tobacco control work for about 30 years now, back when these secondhand smoke policies first started being adopted in the early to mid 1990s. I've had a good career fighting against the leading cause of death and the tobacco industry that causes it. Many communities have adopted these types of policies. In fact, one of the first was a smoke-free multi-unit housing policy that you'll hear about in a minute, adopted in the city of Brisbane, just south of San Francisco. Secondhand smoke policies really started to take off in the mid-1990s into the 2000s. And now rural areas like ours in Humboldt, Del Norte County, Lake County, and Mendocino County, we're playing catch up. In fact, over these years, smoking in rural areas have increased relative to urban areas. Smoking is a rural problem, and Lake County has some of the highest smoking rates in the state. I remember talking to a Humboldt State University student not too long ago. She said, oh yeah, I'm from Temecula down in Southern California. She says, you can't smoke hardly anywhere, not even in the street. And then she kind of looks up in the air and she says, you know, there's a lot of smoking going on around here. In fact, visitors from urban areas and other countries even expect no smoking policies to be present. And it's really a shock to them that people are smoking in such high rates in our rural areas. But now policies are being put in place. The Humboldt State Campus and in fact, the entire California State University system has now gone smoke-free. Following the lead of the University of California system, all their campuses are smoke-free. Most hospitals and medical systems in California now have smoke-free campus policies, and a lot of county health departments have similar smoke-free campus policies. At the 25-year anniversary of the tobacco control programs in California, we celebrated the fact that these secondhand smoke policies not only protect non-smokers, especially vulnerable people like children and the elderly, but they also help smokers cut down and quit. That's why the smoking areas in urban areas are now lower than in rural areas, because they have these policies. The secondhand smoke policy that Clear Lake adopted, I believe it was 2022, is a really solid policy. There's nothing in there that would be at all wrong about a policy to improve the health of all of Lake County. And the good news is that these policies are basically self-enforcing. As in Lake County's policy, it's required that no smoking policies be put in place. And most smokers want to comply. In fact, they want to cut down and quit. So when they see a no smoking sign, guess what? They're not going to smoke there. Now, there'll always be a few people that say they're taking away you're taking away their liberties, or you know, they have a right to smoke, and what's next? But I remind myself, that's the addiction talking. Most people want to do the right thing, and when they see a no smoking sign up, they're going to comply. So outdoor areas, public places, building entrances, plazas, recreational areas, community events, all of these things are included in the Lake County policy, and those are pretty much standard in secondhand smoke policies in urban areas throughout California. And that's about it for me. I'm going to pass it on to Diane, I think, is next, or if there are any questions, we'll get that later.
Yeah, I just have one more thing to say before I pass it on to Diane. Every year, the American Lung Association puts out a report card for the state of California. They identify a grade similar to a report card at school, A, B, C, D, F. And for many years, Lake County as a whole has been in the F category for each jurisdiction. When this outdoor smoking policy was passed for the city of Clear Lake, in that category, their grade went up to an A. Currently, the city of Lakeport is at an F, and the county unincorporated is at an F. So this is something that we are encouraged to educate folks about, to improve that score as well as our health rankings. So I will now pass it on to Diane Kaiser, and she has a little discussion about smoke-free multi-unit housing.
Hey, thank you, Liberty, and good afternoon, supervisors. My name is Diane Kaiser, and I'm with the Health and Social Policy Institute's Communities Addressing Nicotine. I'm standing in today for Gina Lyle Griffin, our lead staff member in Lake County, also with Communities Addressing Nicotine. I know some of you know Gina. Gina underwent a minor medical procedure and is recuperating well, but she asked me to present for her today on smoke-free multi-unit housing. People living in apartments are really more likely to be exposed to secondhand smoke. Smoke can enter through so many areas, through vents, electrical outlets, open windows, even cracks in walls. And interestingly enough, more than 65% of air in an apartment can come from other units in the building, not from outside. When humans come in contact with secondhand smoke, it can be inhaled, ingested, and absorbed into the body through the skin. Children are especially at risk, and their lungs can be permanently damaged by such exposure. Seniors, disabled persons, those suffering from other health issues are at a greater risk and for further complications from exposure to secondhand smoke. And many older people in particular have pets, and actually even pets, when exposed, can be affected. Several years ago, in the city of Fireball, which is in Central California, Fresno County, the city council heard testimony from the parents of 3 children who had to sleep in their van parked outside their apartment because 2 of the children had asthma, and smoke entered their living space from their next door neighbor and their upstairs neighbor. Needless to say, that ordinance passed, and those children and others are actually able to stay and sleep in their own beds. As seen in your packet, there's a document entitled U.S. Laws for 100% Smoke-Free Multi-Unit Housing. And as of last month, January 2023, 77 California municipalities at the city and county level are now prohibiting smoking in 100% of private units of multi-unit housing rental properties. 5 California counties have passed laws, and these laws are working well. Smoke-free multi-unit housing has become an amenity in California. Even the California Apartment Association is helping out with model smoke-free leases. Landlords are saving money, not having to totally refurbish an apartment or a property where smoking has taken place. As a landlord myself, I could not imagine allowing smoking inside a property that I wanted to retain its value, especially knowing that less than 12% of all Californians smoke. So it seems marketing to 88% of the population would surely be better for business. Our organization, the Health and Social Policy Institute's Communities Addressing Nicotine, is available to the Lake County Board of Supervisors to bring a more in-depth presentation on multi-unit housing policies. We can assist with implementation and enforcement techniques at the board's request. We have assisted in implementation all up throughout California, and including Plumas, Amador, Humboldt, and Fresno counties. We specialize working in rural areas. I want to thank you so much for your time this afternoon. We appreciate your interest and your concentration and your efforts on behalf of the health and safety of the citizens of Lake County. Thanks so much.
Thank you, Diane. I would like to turn it over to Mr. Pettis at this time.
Hello, good afternoon. Can you hear me?
Yes, we can.
Good. My name is Jaden Martinez. I am the secretary of the ACT Club, which is All Children Thrive at Clear Lake High School. Our goal is to promote, healthy environments at our school and just in our community in general. And we would like to voice our support for the flavored tobacco ban, as well as banning tobacco from public spaces, since we believe tobacco has great potential to be harmful and should be limited when possible. We agree on the idea of a tobacco selling license, since this brings up the proposition of generating money while ensuring a deterrent for minors. Ultimately, we are in support, but we would also like to see our youth being supported who are already addicted to these substances and will be adversely affected by these policies. Thank you for your time.
Okay, thank you for that support. So I just want to, as on behalf of the whole team here, just want to thank you for the opportunity to present this wealth of information. I know that there's a lot more support documents provided in the packet that we gave you. to further research any of these areas that we've talked about. We look forward to continuing the efforts and discussion related to creating a healthier Lake County. If the board is interested in any further action, we encourage you to consider the areas that we've discussed today and let us know how the partners at the table can assist you and work with the Public Health Law Center to create policies and procedures, models that you are interested in.
Thank you. Supervisor Sabatier.
Thank you so much for coming today. I didn't know I had to make a request for you to come back, but we started this conversation back in 2020. COVID-19 hit. Obviously, public health as an entire department started really focusing on other things, so it wasn't appropriate to make a request at that point in time. My patience was there, then it started slowly disappearing, and that's when I started reaching back out and saying, when are we going to talk about this again? There is a highlighted point that I want to make that resonates in my mind again and again and again, and it was our previous director, Denise Pomeroy, letting us know that the last time that we did a sting operation in Lake County, that 100% of the businesses we went to that sell tobacco were selling to minors. And that is something I can't let go, and that is something that we absolutely need to do. Before I keep going, I do want to share appreciation with the youth that spoke up today. Mr. Pettis' class has the ACT Club. The ACT Club is through Hope Rising, hence why I reached out to them. I want to make sure that we hear the youth voice in understanding where they stand rather than just where we stand based on our experience and our own lenses that we wear every single day. So thank you to that group and Mr. Pettis for leading the charge. Had no idea what they were going to say, but love what they said. And I think that I'll be continuing the discussion with behavioral health on what can be done for those who have fallen prey to the addiction of tobacco. So I'll be brief on what I would like to see us continue on. We have a good setup for the retail tobacco license. It ensures that tobacco is not being sold to minors. There are repercussions if tobacco is sold to minors. I believe it's 30 days, yet you can't sell tobacco if you get busted once, 60 days, or is it 120 days the next? I think it's 120 days if you get busted twice, and then 365 days if you get busted 3 times, or something along those lines. And I think that that is something that helps make sure that that doesn't happen, because that hurts. And I want to make sure that we get people to comply and do the right thing and follow the rules.
Now, is that for all retailers? There's nobody grandfathered in? Or how does that work with new retailers?
It would be all retailers have 90 days to get their retail tobacco license to continue selling tobacco. And then there are consequences if we find you not in compliance with the rules and regulations of the tobacco retail license. And again, with that 100% from before, to me, it's an absolute must that we have to do this. Now, there's a lot of details within there, and I'm not going to get into the details. I think we want to have one specific conversation about the RTL in order to go through the first reading and the second reading, but I think that's something that I would like to see in front of the board for us to look at. Our public parks, currently, I've seen no smoking signs, but we actually don't have a policy of no smoking. I want to see that happen. I know I've had conversations with Director Ewing, and he's prepared for any potential changes that can occur. But I would love to make those environments as acceptable to anyone so that they are not subjected to any kind of nuisance that they shouldn't be subjected to, such as tobacco smoke or cannabis smoke. That's just not the right place for those things to occur. And I would love for us to look at this courthouse and take the example from public health and take the example from our jail facility, and I mean, which is not a perfect apples to apples comparison, but in order to present a healthy environment. We all know that if you walk out the second floor, we have an ashtray less than 25 feet away from the door, even though on the door it says can't smoke within 25 feet. We know the rules, but we're not even following the rules on our own. And I think that we need to just extend that out and make it our health metrics This is the low-hanging fruit. This is the easy fix. This is the easy change. It will not make us healthy in the sense that we suddenly all live to be 100, but we are at 23% based on our latest community health needs assessment, when the rest of the state is at 11% for the percentage of adults that smoke. And that doesn't even include the number of youth that smoke or have access to those types of products. I think we can do better. I think we should do better. And those are the things that I would like to see come back to us immediately. I'm interested in the multi-unit family housing conversation, even though if we use federal grants, which we're most likely to use, it's already embedded in there that they have to follow the non-smoking rules. But why not make it an across the board? So those are my specific comments. Thank you to the entire team. I know I've been working with NorCal for Health for quite a while on this, and also with Blue Zones, and Greg previously was NorCal for Health as well. So appreciate everybody bringing this, and looking forward to the rest of the conversation from the board.
Okay, Supervisor Green?
Yeah, first off, thank you very much. Appreciate everyone coming. Important subject. I'm probably going to part ways with my colleague across the way here on next steps. It's such an important subject. It's a matter of statewide concern, and portions of our tobacco laws are enforced that way, and portions of them are not. Some of the subjects you've raised here today about what retail requirements should be, hey, I will agree. Our retailers are a train wreck. I've asked whether they would voluntarily remove ads. I think they're probably getting paid to place those ads, but I think moving those ads 2 feet away from the candy is not really the solution. There are First Amendment implications for advertisers of state legal products. There are space considerations in our retail businesses, and they're just trying to make a buck. We have tried to regulate other public health issues in this county before, as recently as COVID-19, with very mixed success. And the idea that we would set up the county to be the arbiter and enforcer of these value-added propositions on top of state law is problematic on a couple reasons. One, we don't even have a business license in the county. So the first business license we would have in the county would be for tobacco retailers only, and then all the other retailers and other types of businesses in the county, we still don't charge a dime for a business license. That may be a subject for a different day, but why would we start with a TRL if we're going to start licensing businesses here in Lake County? Whatever one may take of the rights issue involved in multifamily housing, it's there. Whatever one may make of the rights of smokers who work at this particular workplace, who work for this county, who work for our cities, who work for other government agencies, we can argue about what those rights are. But do I think we're making a major health impact by moving them from the second floor to the sidewalk? No. Do I think we're making a major impact when I see people, senior citizens, huddled out in the cold on the sidewalk because they happen to live in multifamily housing that requires them to not smoke in there? No, I don't know that we're making that big difference. So I see these tools in the toolbox, and I am interested in hearing how they might be applied on a statewide level rather than a hodgepodge of, oh, you're in the county, you got to go do this. You're in the city of Clear Lake, oh, it's an outdoor place, you better hunker down and then figure out whatever Lakeport is up to. I don't think it is an effective way at all to basically force upon our public health advocates to go piece by piece, city by city, jurisdiction by jurisdiction to do what the state should do. And I understand there are hurdles for statewide legislation, including our tobacco companies, including the same ones who put the referendum up on the flavor ban, but it did pass substantially here. So I think there is interest in voluntary actions that will continue public health education, continuing outreach on that. I don't know for a fact that the policy goals presented here today are a proper direction for the county at this time. And that's just my opinion. Thank you.
Supervisor Crandall?
Yeah, I met with Dr. Pace, I think, right before COVID, like we were talking about. And I think we talked about this, and we also talked about the flavors, especially when it came to menthol and attracting children, things like that. One thing I'll just, from experience, especially in the military, young kids are in at 18, you know, so cheap cigarettes, cheap alcohol, all that stuff. And one of the things I know is there were a lot of young soldiers that decided to start smoking because they felt incentivized to have an extra break to go smoke with the higher ranking sergeants. So they were like, wow, I can get a break, I can get some, you know, some me time with the guy in charge, and so a lot of them got hooked. Then, of course, high-stress situations being deployed. Drinking also, drinking alcohol also contributes to the addiction because a lot of them go hand in hand. So I think deterrence is a big deal. I think it's something that's like a low-hanging fruit to work with. I think that's if it's inconvenient, a lot of people won't do it. They'll just say, ah, heck with it. That's just from what I've noticed. The other thing is I noticed business licenses were mentioned, but I think, is there a way they can be reported to the California business license if they're doing something, or is that a different process or something along those lines? I don't know. Just thinking of that for the future. You know, I know we don't have those because it's often brought up about other things, but when it comes to, this is a California basically initiative trying to, right? This is California also working with us to do this?
There's multiple states that have tobacco retail license, as
Mhm.
well as counties and city jurisdictions.
Okay.
So it's kind of happening all across the United States, but it's not different
state.
than the state retail license.
Okay.
Because the state retail license will do Stake Act purchase decoys, you know, they'll
Yeah.
have youth with, to do the decoys. But like Bruno had said, it hasn't happened here in Lake County in many years.
Okay.
And,
Well,
and they're looking like that across the state.
okay. Well, then my business license thing don't matter. But yeah, no, I like the idea of doing these things. It's a big deal. It helps because then the store owners are like, I don't want to try it. So, yeah, no, anything that we can do to deter youth, and you know, there's a generation of people that are going to continue smoking. They're not going to. My grandpa was a smoker from 10 all the way to 86, and he never stopped. He was one of the very few that probably lived that long from smoking. But there comes a point when you're just like, pain management, let them do it because they're going to do it anyhow. But a lot of people are, because of some of those folks, a lot of people are like, I don't want to do that. It makes my house smell, makes my car smell, all that stuff. So it's becoming something that's dying out, but at the same time, with these new marketing schemes, it's not ideal. So I'll stop there.
Anybody else? Go ahead.
So I appreciate it. Obviously, yeah, in 2020, we were talking about some opportunities to look at the business license, and I agree, the bigger conversation are their business licenses, other business license we should be considering also, but, you know, I bring it up because, you know, like I said, people are going to do what they feel their rights is to do. You know, yeah, you shouldn't do this, you shouldn't eat too much sugar, but everybody eats sugar. So anyway, I just want to come at it from, if something comes back to the board or is brought to the board, we'll have that discussion then as far as a business license for tobacco. But also, we need to look at it when we talk about who can smoke at the parks, you know, or other areas like that, that we know, and we talk about equity and inclusion, it's the poorest folks that are going to be affected by this. And, you know, that's the hard thing. Where do most of, you know, a lot of our homeless folks, they congregate around the parks, right? You know, so you make it non-smoking, you know they're going to be smoking. At one point, that might run into an interaction with the sheriff, you know, or somebody else. So I appreciate the conversation. You know, I always say it goes back to, you know, teachings inside the home, which we're never going to control, you know, how it is. I came up in a smoking family. I don't smoke. But I drove around in a car as a young man with the windows up and grandma and grandpa smoking, and that was the reality of it. But did I pick up smoking? No, I did not, because I didn't like the smell. You know, so anyway, we're always talking, those are key words, equity and inclusion. And we know anything we implement like this, it's going to affect our homeless folks and other things. It is a concern of mine if we're talking about smoke-free low-income apartments, then we need to be talking about smoking low-income apartments. Because you know there's somebody who has to make a decision, I'm going to keep smoking. Now where do I house my family if I'm going to do that? They can't afford to obviously buy a home. I mean, you always got to be thinking of that, you know, from my point of view. So anyway, it's a hard conversation, but we'll see what comes back here. You know, I did, in 2020, look at supporting a retail license, you know, for the cigarettes, at least that conversation. I don't know where it is, but when you talk about equity and inclusion, yeah, you can say you want one thing, but we know it's going to affect some of the poorest folks in our communities. And even, you know, that's something always to consider, one way or another, because you can't just tell somebody no. So, you know, I don't know if any of you guys like to be told no. No, you can't do what you like. You know, I know I don't like that, you know, and I know there are folks out there, you know. So anyway, we talk equity and inclusion, but sometimes it gets forgot about in developing policy of what I'm going to, or we're going to tell someone to do. And that's really important. That's really important that we do, because it's always affecting policy we usually set up here. It affects the poorest folks on the smallest things. You know, it's hard to have home ownership alone in the state of California, but folks are always looking for places to rent. And, you know, God forbid you make a decision that says, well, oh, I can afford that house, but they have or that apartment, but they have a non-smoking rule. You know, so anyway, those are always things, you know, I just want to bring up. That's the key words right now, it seems like this decade, equity and inclusion. But it's missed out a lot, because all these policies and things that are set up affect the most poorest and the most vulnerable people in our communities. So anyway, that's my thoughts. I don't know if it goes anywhere, but those are just my thoughts right now, because it's forgot about, you know, it really is.
Well, I appreciate your comments and understanding the nexus of why rural counties have higher smoking rates, and what are the communities, who are they, and, you know, what could be the unintended consequences. So I really appreciate your thoughts. We have a hand up in the Zoom room, so I'm going to open public comment. It's phone 7257. Unmute. Is it star?
Star 6.
Star 6 to unmute your phone.
Looks like it.
Yeah.
There we go.
Okay. Go ahead, Bart, if that's you.
Yes, ma'am. Can you?
We can hear you. Go ahead. Please state your name. We're not able to hear you any longer. I'm going to give it one more try. Okay, I think that there's some kind of technical issue, caller, so I'm going to close public comment. I don't see any other hands up. So bring it back to the board to continue our conversation. Oh, Supervisor Crandall?
Yeah, no, Supervisor Simon, I hear you on that. There is a lot of people that don't like to be told no, and I agree with that. My concern about this is deterring children. So, and also ensuring that, you know, it's just discouraged in general. So that's my biggest concern on that. So I know that we're not going to be able to tell adults what to do, and commonly with other subjects, that's always thrown at me, and I'm used to hearing no as a person in Lake County. So other people, it's like, well, you can't be told no, but it's true. He's right, and so I agree with that. But children are the focus for me. So,
Supervisor Spatier?
I wanted to have a bit of a conversation with Vice Chair Simon. I appreciated the comments, but I'm thinking that the conversation is already downstream where we're having it, because I will say that those who are poor are already being victimized by inequity of the marketing and the process to get people addicted. Hence, when we look at who is addicted, typically it's going to be the largest percentage is going to be people living in poverty. And we have to question why, and I hope that we can work on fixing that part so that it's easier for people to make good decisions later on rather than us having to force to make decisions for them. Because it is uncomfortable when you're adults to be told specifically what to do on every aspect of your life. That I will agree with you on. But I think that there's an issue in the way that it's being marketed and who is being targeted by this marketing, and it is the people who are poor, and addiction is very real. So I want to ask you a question because I didn't hear too much about it. Are you okay with moving forward with something like a retail tobacco license? In
Yeah,
the
I
sense,
think I made that comment.
Okay.
Absolutely, I was involved with that. But my thought was really coming from, because I don't have to guess what it is to be poor. I come from a reservation. You ain't got to tell me what it's got to be a Native American in this country and to be desolate, to not know where your next meal's coming. You ain't got to tell me about that. To be home, we're still landless. Native Americans in this country today, which we had our land, no longer do we own it, and we have that right here in Lake County. You know, and so I don't have to guess that, you know, marketing and other things, I clearly understand that because I do that. I bring thousands of people through marketing here to Lake County every day. We bring them every week. So I understand that. And so I just bring up the equity and inclusion and those types of things because I know who it's going to affect. And I, like I said, the retail license, willing to have the conversations from a business standpoint. I think like I said, I agree. I think we need to have business license all the way across county. I think that'll help the county. I ran into some issues on the board of, well, heck, how'd that business start there? Well, we don't have a business license. We can't do anything about it. It's like, okay, well, that's interesting. You know, so having those conversations. So that's really where I come from. And obviously, not promoting for kids to, you know, absolutely. The youth is always in front of mind, but understanding, no matter what laws you put in place or anything, the family dynamics is the most important place to attack those issues and to talk to our children and to be a part of them. You know, I can't expect the government to raise my kids. That was my job. That was my responsibility to understand, to make them to make critical thinking judgments as they grow up. Anyway, you know, those are some things. So not against anything. I'm just bringing up from that point of view. You know, I don't have to guess how laws affect the poorest people because it's been happening to me every day of my life. Now, I've grown, I've gone in different positions, but never forgetting where I come from. You know, I can tell you how to make a commod meal right now today. I can tell you what it's like to eat in. I was never in the service, but you know what we grew up on? Military, what do they call them? MREs? Yeah, MREs. The military meals where you rip it open. Heck, my fruit cocktail didn't even have water. You had to add water to it. You know, you had to make milk out of water in the powder, in which a lot of folks in Lake County have done that, and probably sitting right here in this boardroom. You know, the survival of people and those types of things. But anyway, that's where I bring it up from. The business license, make it very clear. I want to have that conversation as we move forward.
Supervisor Crandall?
This last thing, and I just thought of something when we talked about people that are poor. I agree with the, you know, cigarettes, and I hope if that's a step in the direction, but alcohol. I mean, if folks that are indigent are going to purchase cigarettes and spend $10 on a pack, or whatever the case may be, then a lot of times they're still going to use alcohol too. So, I mean, I don't know if that's another initiative but I see that kind of, again, in my experience, they kind of go hand in hand. And so I just mentioned that, I don't know, I know it's off the subject, but in talking about, you know, folks that, I know indigent folks that will spend their last dollars to get alcohol too and cigarettes. So if they have $50, they'll buy a dirty rack and a carton of cigarettes if they can, and you know, so that's just another thought.
So I'm in favor of bringing some of these policies back to look at, but definitely with the lens of Supervisor Simon's context that he's brought. I think the business license is a good place for us to start, and I think the healthy workplaces are too. And we do have a smoking section right outside the door that all of us have to walk through. And that does not contribute to the health of the rest of the people that work here and the rest of the people that like to enjoy outdoor spaces. I was a smoker, and I lived in San Francisco, and I lived through that conversion where you could smoke everywhere to where you could smoke nowhere. And did it impact behavior? Yes, it did. It does matter. It does matter. I don't smoke anymore. It has been almost 17 years. But I was a smoker for about 12 years. So I understand how to, what it's like and things that can be in place that are not necessarily beating you down with all of these laws, but create an environment where you just feel like making healthier choices. So that's where I stand on this, and I hope we can bring this back. I think we've got a lot of opinions up here. But
Can we respond to any of what we heard, or is that not?
Yes, go ahead.
Yeah, I just wanted to, and I just appreciate hearing from the different perspectives of being a smoker to never being a smoker and being in the, in the car, which is how it was in my family too, windows were up and everything. But one of the things that I've learned is that we don't have a constitutional right to smoke. There's nothing in the Constitution that protects our right to smoke. But we do have a constitutional right to breathe clean air, and that's one of the things I think when we're looking at the protections, we're looking at protecting our youth from becoming addicts to the tobacco smoke and to where we're spending our last $30 on these things because of our addiction. So we're trying to prevent that from happening. The tobacco retail license. So the tobacco retailers have a state license. The state passed SB 793, the flavor ban. They didn't include enforcement, or let me rephrase that. Enforcement comes down to the local jurisdictions for that. So the counties and the cities are the ones that will be enforcing that flavor ban, but they don't have a mechanism to do that. They don't have the funds to do that. So a tobacco retail license will step in and become a self-funded mechanism to be able to do that local enforcement. So there's that. And then I think the only other thing, and asking the team to step in on this, but the idea that tobacco companies are targeting specifically rural, poor, rural impoverished communities to get them hooked is, I think, an equity issue right there. I think the fact that I think that's an equity issue, that we can put protections in place for the future. We know we aren't going to stop. This isn't about stopping people from smoking. This isn't about making it illegal for people to smoke or use these products. This is about being proactive, upstream, and working at the retail level to stop these from continuing to happen and creating more addicts in our community and healthier folks. But
thank you, Joanne. Also, I'd like to add that we would be more than happy to bring back the Healthy Stores and Healthy Kids surveys Healthy Stores and Healthy Communities. We do that every couple of years, and it's something that's done statewide. I was the one that actually went into all of the tobacco retailers in Lake County, and one of the specific questions is, how much is your cheapest pack of cigarettes? And I can guarantee you they were several dollars cheaper in low-income neighborhoods than they were in other neighborhoods in this county. So it is specifically targeting low-income neighborhoods as well to create that addiction. So I'm more than willing to bring back those statistics for Lake County if you would like that.
Supervisor Green?
Thank you. Trying to get some consensus here. So I'm hearing some consensus to move forward with the draft of a tobacco retail license, I would echo some of the comments, alcohol, so like, wow, we're going to do all this for tobacco, and then I'm going to go to Safeway and see an entire row of liquor bottles at eye height of a toddler that gets rolled by in a stroller. So I know it's probably not, alcohol is not in the Blue Zone's portfolio, and you didn't come here today to do that. But if you're going to bring back an ordinance anyway, I wouldn't pull punches and pretend that if I'm putting 2 or 3 feet between tobacco and kiddie stuff, that we shouldn't put alcohol on the same realm. We are talking about behavior modification. We are talking about laws that affect people's rights, whether they're constitutional rights, as has been decided, or rights that just exist in their own mind. And the way we proceed in a positive way is one thing. I do firmly believe this is a state level thing. But if we're going to move forward locally on the consensus here, let's have a TRL that is a TRAL. Let's talk about alcohol. And then it sounds like there's consensus to talk about county workplace policies. Okay with that. I'm going to draw the line myself personally on any further discussion of multifamily housing policies. I think that's well beyond the county's purview, and I think we'd be well advised to stay out of that.
Supervisor Sabatier?
So in a similar vein, just wanted to, I'd love to see a first reading draft for a TRL so that we can nitpick it and provide our input and see what happens from there. And also bring a policy for parks as well as facilities such as the courthouse for discussion, and anything else I'm open for continuing the discussion but not providing direction to come back with something that's law-based, ordinance-based, as it appears that we would need to continue to have the further conversation and better understanding of what it is that we would like to see. But those are the 2 things that I would like to see come back where we can look at taking action.
Supervisor Crandall?
Yeah, and so I just, I agree. Anything that can, you know, this is, like you said, low-bearing fruit. It's already kind of in place. We could work on something like this, but anything that gets us to a path where we could use some of this towards something like meth. I know it's not something that you can buy in a store, but when you said constitutional right for breathing air, and I just immediately thought of communities that, you know, should have a constitutional right to live in peace, but because of the meth problem, they're not. And it's a very difficult problem that I deal with, and I know everyone else deals with in the county. So I know that's a little off subject, and sorry to go off on that, but I just thought of it when you said that. So if it leads to a path where we can use some of whatever's written in there to something like that, I'm glad we're doing something in that direction. So maybe we can tackle that later on. But
Well, I mean, we can't look at our health rankings and metrics and not be committed to do some action. So I really appreciate that we have the consensus to bring this back. I did close public comment, but there is a hand up, so I'll just briefly open it for caller 6205.
Somebody here.
I thought okay.
Hi.
I thought I opened it.
Thank you so much. This is Bart Levinson. Can you hear me?
Yes.
Thank you so much. I so appreciate all of your concern and this presentation. As you know, the discussion about dispensaries, cannabis dispensaries, is front and center in our county. I didn't know that they wouldn't be required to have business licenses. I hope the county will look into that for all businesses, because our county needs support to pay for the staff that supports the citizens and the businesses. And I just want to empathize with the group presenting about tobacco, that many cannabis products are presented to look like tobacco vaping products, and also candies, pastries, sodas, and cartoon-like packaging, definitely appealing to kids. And one of the issues for dispensaries is how close can a dispensary be to schools? So I just wanted to bring awareness to that this is up for discussion at the Community Development Department, at the task force meetings. The next meeting will be on the 20th, Monday the 20th of February, and I hope that we can continue to care for the children and for the people who are low income that are being disproportionately targeted with packaging. Thank you.
Thank you. And yes, we did give that direction to community development to work on the cannabis retail issue. Members of the public in the chambers.
Hi, good afternoon. Just real quick, thank you very much for bringing children into the conversation. I agree, Supervisor Moak, that it is an equity issue, but there's equity with our children. And our children, speaking from a community member, being a community member, and also on the Children's Council, child abuse prevention is always on my mind. And when we deal with families, when children are being referred for services because they smell because of the cigarette smoke on their clothes, they have no control over that. You know, when they are referred to us because the family is having difficulty making ends meet. Well, when the families have to buy cigarettes, they cannot afford to buy other things for their children, like shoes and such. So to me, that's a neglect issue, which is child abuse. So please, whatever we can do to help our poor families get out of situations like that is super important for our future, which is our children. So please just always think about our children for anything you decide to do. Thank you.
Thank you. And we have a hand up from Amber.
That was Anna Santana, just if anybody needs to mark that down.
Oh, thank you.
From,
yes.
Thank you.
Thank you so much. Okay, Amber, go ahead, and you have 3 minutes.
Hi, thank you. Yes, my name is Amber Weir. I am the project director for NorCal for Health. And I'm actually situated, my office is up in Del Norte County. And I just wanted to share 2 more stories actually with you about children. One is, before I even got into this position, I had a youth who was 8 years old. We went to a pharmacy, pick up my daughter's medication, went to the front to, I was buying like toothpaste or something. And he was huffing and puffing, Colton, this 8-year-old I had with me. And I was like, what's wrong? I thought there was someone in line that he was upset with. And he's like, no, I just don't understand. Back there, they want to save us and heal us. And up here, they want to kill us. I don't understand. Well, and I was like, what are you talking about, Colton? And he's like, well, look at all the walls of cigarettes and the cigarettes that are on the counter right there next to the candy, the soda, the chips, and the lighters and the magazines. So an 8-year-old noticed it. I didn't even comprehend this as an adult because I was used to seeing it. But as a young child, you see these things on counters, go into the gas stations, you'll see them on the counters next to the candy. These are evidence-based policies that are promoted throughout the state as ways and tools, as you've heard. So there is evidence to prove that, kids who see it, try it. So I just wanted to share that story of a youth that saw it and I was blind to it. And then I also have a story for a mother who lived in a smoke-free apartment, and she was in an income, a lower income apartment, and it is an equity for them. Her husband was a smoker, but he chose to smoke outside, take off his jacket when he came inside, wash his hands. They were very good about not sharing that secondhand smoke with their youth and their children. The neighbor wasn't, and they had a smoking apartment in their lease. And so the landlord came in, sealed up everything, tried to help out for the children. It was so bad that you could smell it in their toothbrushes, even after they sealed those apartments. We talked to the managers that are the owners of the apartments because the manager was like, that's as much as I can do. The owners were down in Oakland. They said, well, we've never had any problems with this. We've never heard about it. End of story. They didn't want to deal with it. She ended up having a premature baby. having to fly down to Oakland. They informed her of the risks of secondhand smoke with a premature baby, and they still could not get out of that lease to protect her child. She ended up moving 45 minutes away to, oh, is that my time?
Yes.
But she ended up stuck. And when you're talking about equity, it's she doesn't have the options to try to find a new place to live like people that have money to do that, and that they're lucky that they can live in a place that doesn't have secondhand smoke. So it is an equity issue. And I thank you for your time. And I thank you for looking at these policies as a way to address the health of our communities.
Director Turner?
I just wanted to correct something that was stated in public input regarding the Cannabis Task Force meeting. The next regularly scheduled meeting falls on President's Day, so we will not hold the meeting on that date. The Cannabis Program Manager is working with the task force to see if they want to hold a meeting on a different day at that time or in that week, but we'll skip that meeting, and then it'll be 2 weeks after that.
Thank you so much. Okay, now I will close public comment. I'm sorry about that. Supervisor Green?
Yeah, just really quick. One of the commenters was talking about the cannabis regs. The cannabis regs are statewide regulations. They highlight the point that this is a state issue and should be regulated as such. The state regulations already prohibit marketing to children, already prohibit the use of cartoons and likenesses, require child-proof packaging before any cannabis exits those dispensaries. And yet they are handled so differently. Again, you can get alcohol in any store in the county, but you got to go knock on the door and show your ID and do that just to prove up to use cannabis as a substance. So it's fascinating. It continues to fascinate years and years later how we distinguish between alcohol, tobacco, and our cannabis regulations and appear to conflate them. So I just want to set the record straight. The state regulations pertaining to cannabis and prohibiting marketing to children and ensuring that child-proof packaging is adequate, it's already there. And yet still we have people in our community, and I don't want to put out one of my former colleagues, but it's like, oh, if it's going to exist at all, we should send our cannabis users to speakeasies, out of sight, out of mind, and then it won't be a problem in our community. So some of these things we're talking about here, you know, they all sound common sense, but they're all baby steps toward prohibition, and we know prohibition doesn't work. So if these are state legal substances, harmful as they may be, and adverse health impacts that they may have on an individual basis, we have made choices over the years that the individual is the ultimate arbiter of that decision, not the government. So, you know, as we go down this road, you know, just be careful what you ask for, because if you think a TRL is good for our liquor stores, maybe an ordinance that would force them to have a standalone business, a smoke shop only, a liquor store only, and you can't come in the door unless you show your ID, and then you can go shopping for your liquor. I mean, you know, if we're going to put everything on the table, let's talk about that. But the idea that moving something 2 or 3 feet away from here is going to make a meaningful impact, the idea that forcing people out in the cold in their own apartments is going to make a meaningful impact, it does come back to personal choices. It does come back to parental education. And if you want a good model, look to our state cannabis regulations to follow. Thank you.
It is personal choice, but when your personal choices affect other people, I think that's where our conversation is right now. Okay, anything else?
I believe you have consensus.
We have consensus. Okay, well, really appreciate the conversation. I know this was put on hold for a while, but we're glad that you're back here and that we can move this along. So thank you for your time today. Our next item is timed for 1:15, but we're going to be taking a 1-hour lunch break. So we will be back here at 2 o'clock. We'll be back here at 2 o'clock.